the Hindu Council of Kenya Kisumu branch, we organize this function and we start with a program and start with a prayer, and I request Sri Dakshit, by the way, the priest of Sanatana Indian, to come and pray for us and request everybody to be upstanding.
पश्येम शरदः शतगुं शृणुयाम शरदः शतं प्रब्रवाम शरदः शतमदीनाः श्याम शरदः शतं भूयश्च शरदः शतात् सर्वेत्र सुखिनः सन्तु सर्वे सन्तु निरामयः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्। श्री लक्ष्मी नारायण भगवान की जय।
And first of all, I request our chairman to present the bouquet to Dr. Lapsa. Thank you very much. Now I request our Vice Chairman, Mrs. Madhurya, to present the bouquet to Dr. I request another Vice Chairman, Mrs. Alka Waghela, to present the bouquet to Gaurav Mehta. Gaurav, બીજાનું નામ શું છે? I request our treasurer, young treasurer, Kunal, to present the bouquet to Deepak sir. Thank you very much. Now I request our chairman, Mr. Parminder Sira, to welcome for the welcome address. Parminder.
The Council of Kenya Kisumu Management Committee members, past chairman, institution chairman and chair ladies, ladies and gentlemen, all protocols observed. A very good evening to you all. It is my very proud privilege to welcome you all to this workshop titled Balance, the Ergonomics Workshop. A very special welcome to Dr. Alap Shah and his team consisting of Dr. Sagar Bhatla. Request them to please rise. Dr. Alap Shah, Dr. Gaurav Mehta, Mr. Gaurav Mehta and Mr. Deepak Shah. Mr. Deepak Shah is from Nairobi and he is the local coordinator. Thank you. They will be conducting the workshop this evening. Ladies and gentlemen, as you are all aware, Hindu Council of Kenya Kisumu is the coordinating body of 21 member institutions. It organizes various events, amongst them social and medical, We have always received good support from Kisumu public, and we are grateful for that. Ladies and gentlemen, changing lifestyles, climate changes and other causes have had adverse effects on our bodies. Utmost care is necessary to counter these effects, but more often than not, we tend to ignore the causes only to regret later. To overcome and prevent these effects, we have individuals like Dr. Alap Shah and his team who have carried out a lot of research and studies and have devoted their time and energies to make our life better. More than 700,000 people to date all over the world have benefited by this unique workshop. And amongst them, none other than the Prime Minister of India, Mr. Narendra Modi. Dr. Alap Shah, once again, on behalf of the people of Kisumu, I welcome you and your team to Kisumu city and thank you for choosing Kisumu as one of your destinations. Ladies and gentlemen, a more detailed introduction of Dr. Alap Shah will be given shortly. I will be failing in my duty if I did not acknowledge and recognize the following for their efforts. Our evergreen young secretary, Mr. D.P. Mandavia, for all the organization work. Mr. Ramesh Mehta, our medical convener who has been coordinating this function. Mr. Kinjal Parekh for all the visuals. Mr. Mansukh Patel for the PA system. Mrs. Sujata Derodra for catering arrangements. Mrs. Sheila Chauhan for decorations and other assistance whenever we requested. And our office secretary Nancy for all the office administrative work. Once again, I thank you all for attending and hope everybody benefits from this workshop. Ladies and gentlemen, I will now hand over back to the Master of Ceremonies. Thank you very much.
Now I request Mr. Ramesh Mehta, who is the past trustee of Hindu Council of Kenya and the convener of the medical committee of Hindu Council of Kenya Kisumu branch, to come and introduce our guest and then invite him to address us.
Introduce our very special guest of this evening, and just you know, it is only this evening that I met him. In fact, this afternoon, and my first impression, right? I was told that this is Dr. Alap Shah, and I said, "Is he a doctor or a Bollywood actor?" You know, I was just wondering. You know. Anyway, it's indeed my pleasure, privilege and honor to introduce to this wonderful gathering a very, very fine personality, an extraordinary man with charm, wit, talent, intelligence, and a man of tested ability, sound judgment, and keen perception. I've spent about 3 or 4 hours with him today, and then I can make out the qualities of this particular gentleman. Dr. Alap Shah is the founder director of Mission Health, world's finest and most advanced chain of super specialty physiotherapy, fitness and rehabilitation center. He is accredited with a master's degree in physiotherapy and many international certificates. He is also a holder of PhD in spine rehabilitation. Very well known in his field, Dr. Alap Shah has several publications in national and international journals to his credit. He is an author for many national and international newspapers, magazines, and write-ups in a wide array of subjects pertaining to physiotherapy, fitness, and rehabilitation, including, ladies and gentlemen, the Asian Weekly newspaper, which is published in Nairobi. Dr. Alap Shah, driven by his passion and belief that knowledge expands and society progresses through its dissemination, has made his mission to raise global awareness about lifestyle disorders and equip people with preventive practices. To this end, he began conducting workshops and has become pioneer in the field of ergonomics across the globe. Along with his team of dedicated and specialized physiotherapists, Dr. Alap Shah has educated more than 700,000 people on ergonomics and other health subjects, the list of which includes the Prime Minister of India, Honorable Shri Narendra Modi, the late President of India, Honorable Shri APJ Abdul Kalam, Home Minister of India, Honorable Shri Amit Shah, Chief Ministers and Cabinet Ministers of various states, IAS, IPS officers, sports, and Bollywood celebrities. As I said earlier, I thought he is one of the Bollywood guys, as well as many corporates. Dr. Alap Shah leads India's largest team of more than 400 specialized physiotherapists at his Mission Health Center. Mission Health Center, for your information, ladies and gentlemen, is in Ahmedabad, Gujarat, India, occupying an area of about 250,000 square feet, spread in 8 prime locations, and they are soon launching 2 more centers, one in Ahmedabad and another one in Surat City. So that already proves the demand, they have. Mission Health also houses 5-star rehab suites for accommodating global patients. Now, this is something very interesting because, if you are a patient and if you happen to be in Ahmedabad in Mission Health, you need not be staying in a hotel. They have that 5-star rehab suites. You can be treated in the morning, for a few hours, then you can always go around and, move in the city of Ahmedabad. I think that's something great. And since its incorporation in June 2007, more than 200,000 people have benefited from Mission Health's physio, fitness, and rehab services, and solutions of which 60,000 patients have been successfully treated for spine-related issues, and 50,000 for knee issues have been successfully treated at Mission Health. The list of Dr. Alap Shah's Mission Health awards and accolades over the past years is long, and this includes awards for Best Physiotherapy, Fitness and Rehabilitation Center in India by the Times of India Media Group, Divya Bhaskar Media Group, Fitness Excellence Awards, India Association of Physiotherapists, besides a host of others. Mission Health team takes pride in serving all religion saints honorary at all branches of Mission Health since the day of inception. Right from the word go, they have been treating all saints, all religious saints at no cost. That is something great, and I believe, Doc, that's one of the reasons you have progressed, leaps and bounds, Congratulations. Surely Dr. Alap Shah is a philanthropist caring for the world population without discrimination. And today he is here in Kisumu. Yesterday he was in Eldoret, and a day before the whole team was in Nairobi, Kenya, and has visited many more nations all over the globe voluntarily just to reach out the populace of the world. That is something great, I would say, a great philanthropist. Indeed, Dr. Alap Shah is a man of superlatively high standards and boundless enthusiasm for his vigor to relieve the world of chronic ailments that has tormented human race for decades. Now, ladies and gentlemen, I can keep on talking about this gentleman, for half an hour, right? But of course, you would be keen to listen to him rather than me, right? Okay. Now, just before I invite Dr. Alap Shah to address us, let me also take this opportunity to introduce his teammates, right? The guys who have joined him. We have Dr. Sagar, please, the assistant to Dr. Alap. Then we have Mr. Gaurav Mehta, administrator and the director of Mission Health, right? Again, here with us. We have a very good friend of ours from Nairobi, Deepak Shah from the Doshi Group of Companies. And at this stage, Deepak, I would like to thank you most sincerely for connecting us to Mission Health and Dr. Alap's team. Thank you very much. We really appreciate it, right? Now, ladies and gentlemen, I give this wonderful audience the real gift of the occasion. The real gift of the occasion. The man you've been waiting to hear. None other than one and only Dr. Alap Shah. Thanks. Sorry.
Jambo. Habari yenu, right? Mazuri sana. And when I end the lecture, I have to say Asante sana. And all of you will be telling. Even before I met him, I heard about him from a friend in London who was with us on dinner at Ahmedabad. He belongs to Kisumu. Ramesh Bhai Mehta, thorough gentleman. Whatever few conversation we had in last few months has been putting special efforts to make this event possible selflessly, just for the benefit of the Kisumu's population. Madhu Hariya Madam, Alka Waghela Ben, Kamal Bhai Mehta, Hasmukh Bhai Patel, up, right? Apne mic mate we were doing this work. Such keen interest, even managing sound. He gave me 3-4 options. That this you like or that you like, which one you would prefer. Corporates also cannot manage this way. We go to topmost corporates in the world to talk, but this is a different way to manage. Kinjal Parikh, immediately when he realized we need sound connected to the video, rushed to take this. Prakash Bhai Soni. Also, there was one gentleman who was singing very good. Which song he was singing when we were doing mic check? Wonderful in the romantic song. So and you, sir. So all of you, just few hours and I have 10 friends and we are going to learn something which is going to be experienced for the rest of the life. Narendra Bhai has attended such program of ours more than 6 times. In 2009, 7th December, Abdul Kalam sir told, this workshop will remain in my memory forever. So something very different, very unique. Now I have few concepts which I have brought to talk here. One is spine, one is knee, one is varicose vein and legs issue, one is neuroplasticity, one is pelvic health. But we will limit because we don't want to make today's workshop like my dear friend Anant Ambani's marriage ceremony. So we try to restrict and try to learn as much as possible in the given span of time. And first let's talk about the problem which is hindering many lives, that is knee. Why did the scarecrow win an award? Because he was outstanding in the field. Intense cushioning and lubrication between two bones. Now imagine we are standing here. Somebody is having 80 kg weight. Now let's understand the weight above knee is 60%, 70%, 75%, 80%. Weight below knee is just 20%. So somebody weighing 80 kg will have 60 kg plus weight above the knee and 20 kg below the knee. But do we fall? How nicely we are able to stand. We don't collapse, we don't fall. We are so much able to keep our body upright. Somebody having 100 kg weight is having 80 kg weight or 75 kg weight above the knee level. Yet we don't collapse. Why? There are three systems. Active support system, passive support system and neuromuscular control. When I say active support system, why we need to understand this system? Because such systems, if we keep strong, our support, stability, mobility, everything will be well maintained. So this is active knee support muscles like quadriceps at the front of the thigh or hamstring at the back of the thigh. Active knee muscles work at our own desire, our own command, our own will. But there is one system which is called as passive support system, which is ligaments. They don't work at our will. And there are essentially four ligaments, one inside the knee, one outside the knee, one crossing front to back and other back to front. So they hold our knee joint so nicely and we are able to stand half an hour, 1 hour, walk on uneven surface, go down, go up, run fast, run slow, run uneven surface. So these are the two systems, and there is third system called as neuromuscular control, which coordinates between active, passive and brain. Whenever the challenges come, they come into action. So this was just to understand a little bit about me. I will request all of you to sit. I just forgot to tell you to sit. So whenever we talk of knee pain, I tell all my patients, every knee pain is not degeneration. Darek knee pain એ ઘસારો નથી. And every knee pain doesn't require surgery. When we talk of reasons for the knee pain, there are more than 13 causes. One of them is muscle injury, ligament injury. Remember this very well. Meniscus injury, gadi, cushioning between two bones. One more activity we will do when the meniscus comes to understand the role of meniscus. Muscle imbalance, overweight, cartilage loss between upper bone and lower bone, cartilage loss behind patella, kneecap, higher uric acid level, autoimmune condition, arthritis, rheumatoid arthritis, not osteoarthritis. When we talk of arthritis also, there are more than 100 types of arthritis. For example, rheumatoid arthritis, osteoarthritis, seronegative arthritis, psoriatic arthritis, gouty arthritis, post-COVID arthritis, chikungunya arthritis, so many variety of arthritis. Or a simple sports injury, or something very important which is missed opportunity for all of us, biomechanics, the alignment of other joints affecting alignment of the knee, which we'll discuss, and this is going to be very interesting for all of us. So today's understanding, we divide the knee pain in two parts, knee pain before 40 and knee pain after 40. Now, how many of us sitting in this room are suffering from knee pain or have suffered from knee pain at least once in a life? Let's raise fingers just to understand the so many, at least 60% or more. Now let's understand knee pain before 40 years. Imagine 30-year thin girl coming to a clinician with knee pain, and she doesn't have any history of any injury or any medical disease. Doctor keeps doing x-rays, patient keeps consulting various consultants. 6 months are passing. Neither patient nor a doctor is able to come to the conclusion. What is the reason of this young, thin, 30-year knee pain? And there is no injury history, there is no uric acid, there is no arthritis, there is nothing, the reports are not showing anything. We'll go to that. So there is a strong link between knee pain and hip and foot alignment. We can never separate these three joints because in closed chain, we cannot separate hip, knee and foot. What is open chain and what is closed chain? When you are sitting and you are moving legs, that is open chain, but when you are standing, it is closed chain. When our body is in contact with the ground, we can never separate hip, knee and foot. For example, for knees to work perfectly, pelvis, hip and ankle, foot must be aligned. Now somebody is having tight hip internal muscles, it has impact on the knee. Somebody is having tight hip external rotator muscles, it has impact on the knee. Let us talk about foot little bit and we'll practice also on this and understand our own arches. Foot is the foundation of human body and first contact point between body and ground. What is the alignment of the foot? Outer border of the feet is always in touch with the ground, whereas inner border is in the air. We call that part as medial arch. Now what happens? Many of us are having flat foot. We'll check right now also. And flat foot is also two types, static and dynamic. Static meaning it is absolutely flat like this. There is no arch. Dynamic meaning we have little arches, but when we take weight on the ground, that arches collapse. Thodo khado che, but as soon as you take weight, khado flat thai jai che. That's dynamic flat foot or low arches. Now what's the relation between this foot and knee? Whenever our feet is flat, there is something called as internal rotation of the leg and outer lateralization of patella. You say, Doc, what is this? Why even it is relevant to us? In simple terms, if we understand, if arches of feet are low or flat, the leg rotates, patella is tilted outside and the cartilage layer behind the kneecap starts getting thinner. We call this condition as chondromalacia patella. I want all of you to keep your hand on your knee. Do this up and down movement 2 to 3 times. First right, then left. First right, then left. Okay. How many of you felt some noise coming out of your knees? Just raise fingers honestly, because almost many of us are married, so this will not be a judgmental criteria whether the guy with more noise will be not an ideal choice. So how many of us got that noise? Can you raise the finger? So many of us. Now if we divide it into categories, somebody got this noise with mild variant and somebody got it with severe variant. There is also showing the amount of cartilage softening within the knee joint, behind the patella. And this is not always elderly population. This is many a times young population. And this has relation with the feet. So we would like to check feet of all of you. Whosoever is in position or comfortable to remove slipper, chappal, sandal or shoe, just stand and check your own arch. And we quickly summarize these in 2 to 3 minutes. There are a lot of activities we have to do. And Dr. Sagar, you can help me checking. And if somebody is having complete flat feet, can come on the stage, 2 or 3 people, so we can understand. For example, Suresh Uncle arch sari dekhaye che. He has reasonably good arch. Apni pan arch sari che. Can someone come with flat feet? Just remove your check your own arch. Underneath side you have this arch available or not. Do we fall here or here? You have to identify. And again, the ideal analysis will come in standing. I would appreciate, don't talk internally because we will miss something. Just check for your own self and then you can come on the stage to show me. Yes, please come. Please come. Just be careful. Yeah. Now I want you to keep your arms like this. So we can clearly see this is classic static flat foot. Juo, arch જ નથી, ખાડો જ નથી. Can we see this? And now what happens? why her toe is like this. It is not arthritis. Neither it is arthritis, nor it's a bad karma. It is genuinely a mechanical alignment issue. Because when our arch collapses, what happens when this arch is collapsing? Toe is bound to come out. This is called as hallux valgus. And in long term, what happens? We keep walking. Every time during the walking, when the I asked to sit. You can sit, no problem. But some of us should come on the stage to understand what is your arch. For example, this is completely flat foot. Please, whosoever wants to sit can sit, and whosoever wants to join here. This is completely flat foot. Now what happens? 3-4 things starts happening. I appreciate, don't talk internally because we will miss a lot of things. When arch is like this and when it gets flattened, તમે એવું સાંભળ્યું છે હાડકું વધ્યું? કેટલા લોકોએ સાંભળ્યું છે? તો હાડકું કેમ વધે છે? Okay, let me ask very simple question. Egg came first or hen came first? Anybody? Egg or hen? ઈંડું પહેલા આવ્યું કે મરઘી? કંઈક તો કહો. ઈંડું. પણ એને મૂકવાવાળી મરઘી ક્યાં હતી? So there is a very strong relation between arch of the foot and this calcaneal spur, વધારાનું હાડકું. What happens? Understand? આ જે arch હોય ને, એની એક specific length હોય. And there is muscle called as plantar fascia which is attached from this point to this point. Plantar fascia do not know whether my owner is flat feet or good arch. So when plantar flat feet happens, the arch is stretched at both ends. Are we getting this? Sava? So when this is flat, plantar fascia gets overstretched. And these 5 people are more powerful to pull from the heel and reactional spur. So every time some of us in this room can agree with me, jene edino dukhavo che, every time you get up in the morning, first few steps are very painful. Do you agree? Whosoever has felt that. Why it happens? Because in the night feet are like this, and when you wake up your foot gets collapsed. We have seen in the microscope for research purpose in the early morning when the arch is on the ground, it gets collapsed, and we see micro bleeding happening at the heel area in this region, specifically here. So she is flat foot. So she is the example of low arch, not complete flat foot. See, there is mild arch. Now you stand and relax completely. Yeah, so then you are almost getting converted. So in her case, 110% flat foot. Just to explain you the severity. In her case, 90%. So 10% only is available, 90 is lost. Can you come forward? Anyone would like to get it done?
I have a calcaneal spur right now.
Yeah, so just spread this. No, not like this. Yeah. So you also have classic low arches. બસ એક બે જણ પૂરતું જ છે, આવી જાવ જણ. So low arches, flat foot, you can come down, please, નીચે. અથવા તો ફોટો પડાવો તો પડાવી લઈએ, બેન. So he is low arch, you have some arch, but low arches. Anyone? તમારું તો કેવી રીતે ખ્યાલ આવશે શૂઝમાં?
I've got a flat feet, yeah, and I can only walk with these shoes. These are Skechers with a soft sole.
We'll talk on that. So we don't want to disturb you right now, but whenever you are on your chair, we'll remove and check the arch so that you are not uncomfortable here. So our arches will be resulting into softening of the patellofemoral cartilages, as it was lightly said in the previous times of our grandma or her grandma, કે જેની આર્ચ સારી હોય ને એ લક્ષ્મી લઈને આવે. પણ એવું કંઈ હોતું નથી. અહીંયા ફ્લેટ ફૂટ વાળા પણ સારા લોકો, સમૃદ્ધ લોકો બેઠા હશે. So this is just on a laughing note, but flat foot વાળો definitely નીની લાઈફ 5 થી 10 વર્ષ ઓછી થાય. So this is a correctable factor. Yes, again complete flat foot, there is no arch. Done. Please have a seat. Thank you. So we have many flat feet sitting here, which is biomechanical analysis. Now that 30-year female we were talking of, people were searching for 6 months for her diagnosis. She came to our consulting room. We thought nothing, just asked her to raise her pant, check her arches. checked the knee, the noise was there. Her complaint was stair descending was more painful than ascending stairs. Within 5 minutes the diagnosis was done. So what we did, the cartilage of the knee were soft. We have a technology called as ATRT, cartilage regeneration therapy, which is again non-invasive physical medicine. We did that. Her arches were flat, we corrected it. We corrected it by 2 means, active support and passive support. Active support was her own muscles. There is a technology called a superinductive system by which we stimulate intrinsic muscles of the feet. And there are group of natural feet exercise which has to be done at home by all of you. Today we'll try to learn something take home which you can start doing from tomorrow itself. For all flat foot, we'll practice this once this is concluded. But this is like driving a car without wheel alignment. So we did some insoles which were customized with 1 mm precision. My size and your size over the counter cannot work. So we use some insole. Today, this is the same insole which across the country and across the world, topmost sports players are also using. But we being in a normal life, we don't realize the importance of it. The minute we put arches, taught her certain exercises, stimulation was done, cartilage therapy was done. 20 days to 30 days, she is 100% all right. એને 5 વર્ષ થઈ ગયા, કોઈ problem નથી. You're getting my point? We kept searching only at the knee level, but the cause was somewhere else. So there is some feet exercise that at least I can teach you right away, which all of you can start doing. All of you stand. જેને શૂઝ પહેર્યા છે રિમૂવ કરવા માટે વ્યાધિ ના કરતા. Just do this feet curl. Curl your feet. Curl your feet. તમે આવી જાઓ. Can you come up just to show? Just 1%. What you are going to do, you have to, as if there is some object behind below your toes, you have to bring that object down to close to the heel. Curl the feet, yes, and hold it. You are doing it perfect. Hold it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. Another count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. Thank you. We appreciate. What's your name? Okay. Thank you. So, this is the exercise we all will start doing from tomorrow itself. 10 counts in the morning, bare minimum. If somebody is lucky to do it in the evening, we can always do it. For the flat feet people compulsory, and rest of us also with good arches must start doing it because it will give. There is another science between flat feet and frequent falls. No internal discussion, please. Tamara flat foot, we will analyze separately. Badana, please have a seat. You cannot see the screen? Can we help in rotating it little bit? Okay, it's just, this is my feet. We curl the feet, hold it nice. Agar pachal batao na bhai. And then relax it. Got it? But hold it 10 counts and slowly relax it. Got it now? Very simple. Another important thing is, if you are sitting for 2 to 3 hours, make sure you do this movement 2 to 3 times. By doing that, we are doing lubrication of the synovial fluid to the cartilage of the knee. Cartilage of the knee requires some movement at frequent interval so that the lubrication happens in the synovial cavity and you keep your knee wet and lubricated, well lubricated. Done? Sagar, we'll go to the next slide. Thank you. So this was little about the feet. Now why are so many flat feet? Any specific cause can you tell me? કેમ આટલા બધા flat feet વધી ગયા છે? Number 1 is weight, perfect. Number 2, feet muscle weakness. Number 3, wrong shoe. Number 4, the most important reason, stress has no much relation, but yeah, everything else we can always boil down to stress. Number 4, nature. Now I am concluding it. Nature versus civilization. Our feet, human feet, were meant to walk on soft surface like grass, sand. Surface was responsible to adjusting our placement on the foot, whereas now we walk on vitrified, concrete, marble, Kota, all hard surfaces. So now surfaces no more play the role to adjust us. Our arches adjust to the surface and they get flat. So two varieties of flat foot, congenital and acquired. Congenital is by birth, acquired is we acquire. And static and dynamic, static is total flat feet and dynamic is the way we discuss due to collapse, weak muscles, weight and lot of other parameters. So driving a car without wheel alignment is flat feet, which has a relation with the knee. The minute we treat hip or feet alignment, knee will automatically start responding better. This is the effect we study. Some people leg is like this, we call it bow legs. Some people has legs like this, we call it no knee. They need proper guidelines. How many of us sitting in this room are actively involved in sports? Please raise finger. So you see, the ratio is so much matching with each other. When we ask how many of us suffering from knee pain, 60-70%. When we ask how many of us sports, 20%. So this matches well. This is a clear guideline that all of us. How many of us are involved in some kind of good physical activity? It can be good yoga, good walking. So that is encouraging. So rest of us, tomorrow onwards, we must start participating in whatever, if nothing, start walking and whatever bare minimum science we can participate. Why I'm talking on sports injury? It's a missed opportunity, the way the rehabilitation is done. We talked of ligaments, that is passive support system. There are grades of ligament injury. Grade 1 is mild strain. Some fibers are stretched, but there is no tear. Why I am explaining you on ligament injury? Because one of us has already suffered from ligament injury within this room, or if not us, one of our relatives has been affected with ligament injury. And the diagnosis and planning for the ligament injury is always critical because it requires thorough analysis, and it's a clinical analysis, because if we go on MRI, we always go wrong. We cannot rely on MRI when we are treating ligament injury. We need to rely on thorough clinical examination. We had a colleague called as Dr. Nazaf Sheikh. She is in Canada now. Her sister-in-law suffered with some ligament and meniscus injury. Rather, MRI was showing ligament and meniscus injury. So we decided to go in and repair with arthroscope, that is Durbin. When we went inside, the ligament was intact. So we just cleaned here and there and came out. So you can never rely on MRI. Understand, don't get afraid when somebody sees your MRI and says, oh my God, your knee is this or that. No, clinical is the most important science. And why did this happen in this lady's case, that MRI was showing tear, and clinically when we put arthroscope inside? Because in radiology also there is in MRI 1.5 Tesla or 3 Tesla, it just magnifies the whole picture. And sometimes because of inflammation, swelling or little twisted alignment while taking shapes, T2 signals are high or low, things change. So we can never rely on only MRI. Clinical examination is important. So grade 1 is mild, grade 2 is partial tear, where part of the ligament is damaged but still in contact, and grade 3 is completely torn. Now understand, this ligament called as MCL is very much approachable. I can touch here, this is my MCL. Now if it is grade 2 ligament injury where there is partial contact, we no more operate. Good news is there is fantastic technology called as HIRO, HIRO, TT, thermal threshold, where we put a diode on this ligament right here. તાકણી પણ નહીં, ખરોચ પણ નહીં, કાપો તો દૂરની વાત છે. With thermal threshold, we reduce the temperature in -degree, and then we deliver 3000 W pulse. Within 20 days, this starts healing. But now imagine there is complete tear. Clinically also unstable. When ligament injury we are treating patients, most important complaint, patient કેવું કે સાહેબ ચાલતા ચાલતા પડી જવાય છે. I lose balance, I lose confidence. At that time, we need to do something. Now again, there is age and requirement based science. For example, there is 30-year boy who wants to play football or a cricket, and his ligament is completely destroyed. We may have to take decision to repair it, but clinically he should be showing signs of instability. Clinically patient એવું કહેવું જોઈએ કે મને instability feel થાય છે, અને આપણને ચેકઅપમાં ખબર પડે છે. But imagine માંડવિયા સાહેબ એમ કે ગ્રેડ 3 લિગામેન્ટ ઇન્જરી છે, ટેર, પણ ઇન્સ્ટેબિલિટી એટલી બધી નથી, લાઈફ ઇઝ રિયલી ગોઈંગ ગુડ, તો એને છંછેડાય? Demand is very clear. For example, 25-year boy with shoulder muscle tear who wants to play volleyball, we may have to operate. But 70-year female with complete tear, same report. I ask her, do you want to play tennis? She says, no. I ask her, you want to lift 2 kg, 3 kg weight in everyday life here and there? She says, yes. We will make you capable enough for that. Why do we need to operate? Science is crystal clear. That is the decision-making process which is lacking in many part, or rather most part of the world. Because people don't have time. Our examination is not 5 minutes examination. If I want to really check and give you time, I need 30 to 45 minutes in detail to understand everything in nitty-gritty, and then we can go on a decision-making process. Another important thing, meniscus injury. I want all of you to stand. What is meniscus? ગાદી. એનો રોલ છે કુશનિંગ, શોક એબ્સોર્પ્શન. આપણે જ્યારે કોઈ પણ જર્ક આવે તો ધ શોક એબ્સોર્પ્શન હેપન્સ ઇન ધીસ મેનિસ્કસ. સો જે પણ કમ્ફર્ટેબલ હોય, બધા નહીં, એ ખાલી સ્લાઇડ પોતાની પ્લેસ પર જમ્પ કરો. નાઉ જમ્પ, યુ લીવ ધ ગ્રાઉન્ડ. યા, સો વેન યુ જમ્પ, એક વર્ટિકલ, there was vertical translation of the body, impact of your body weight and gravity on the knee. So that shock came. This shock is horizontally dissipated in the substance called as meniscus, that is gadi. Half of the people in the room might have meniscus tear grade 1. So never get afraid of MRI report showing grade 1 meniscus tear. We are worried when it is grade 3, and we are not even worried about grade 3. We are worried when patient says my knee gets locked. પેશન્ટ એવું કહે ને કે ચાલતા ચાલતા મારો પગ લોક થઈ ગયો, મારે ઊભા રહી જવું પડે, પછી 2-4 મિનિટ હલાવું તો ખુલે, અથવા તો વાઇલ સ્લીપિંગ, આ લોક છે ને, આ તો લોક છે ને, નહીં તો મારે લોક. સો when you bend knee and suddenly you are not able to straighten, that's a locking. In that case, or there is a bucket handle variety of tear, આપણું બકેટનું હેન્ડલ આમ થતું હોય ને, meniscus is moving like this within the knee joint. In that case, we may take to operate. Otherwise, we don't touch meniscus, because International Arthroscopy Society guidelines are showing that the minute you remove meniscus, બે બોન એકબીજાની નજીક આવવા માંડે. So 5 વર્ષ પહેલો ઘસારો તો એમને એમ ચાલુ થઈ ગયો. So science is so much taking us in the ideal guidelines about exact clinical analysis leads us to exact treatment strategies. Thank you. Please have a seat. Now tell me, which is the normal leg? Okay. આ બેમાંથી કયો નોર્મલ છે? લેટ્સ નેમ ઇટ રાઈટ એન્ડ લેટ્સ નેમ ઇટ લેફ્ટ. કોઈ પણ એક જણ આંગળી ઊંચી કરીને કહો, વિચ ઇઝ નોર્મલ લેગ? સો ફાર વી આર ઓલ ગોઈંગ કમ્ફર્ટેબલ? છેલ્લી સીટ સુધી બધાને સમજાય છે? એબ્સોલ્યુટ કમ્ફર્ટેબલ? પ્લીઝ રમેશભાઈ. લાઇટ્સ, વી કેન ડુ ધેટ. તમને આ દેખાય છે ને બધાને? મારા માટે ઇમ્પોર્ટન્ટ છે. થોડીક લાઇટ પાછળની સાઈડ કંઈક ઓન કરો એવું લાગે તો ટેલ મી. આ લાઇટ ઓન ના કરતા, નહીં તો સ્ક્રીન રિઝોલ્યુશન વિલ ગો ડાઉન. એન્ડ સો ફાર આઈ થિંક લાઇટિંગ ઇઝ ઓલ્સો લુકિંગ ગુડ, બટ પાછળની કરી શકાય. ટેલ મી, વિચ ઇઝ નોર્મલ લેગ? રાઇટ ઇઝ નોર્મલ, right is abnormal. Right is abnormal. Now I am concluding it. Right is not normal. And most of us thought right is normal. Now what happens after major sports injury, ligament injury, synovitis, infection, inflammation or degeneration? There is muscle inhibition. Muscles weak થવા માંડે, સ્નાયુ નબળા થવા માંડે, muscle પતલા થવા માંડે. And then you get into this category. The leg is looking like a polio. But it's not a polio. It is a leg of a sports player who after sports injury did not do proper rehabilitation. And there are cases where we see Zaheer Khan, BCCI Indian cricket bowler, 2005 to 2015, 10 years of very good bowling career. He's a close friend of mine. 10 years, 33 injuries, 7 surgeries. Did you ever feel he's such an injured fellow? No. Because his rehabilitation was done right. આપણા ત્યાં કેવું હોય, કોઈને નીમાં ઇન્જરી થઈ, till what duration we treat? જ્યાં સુધી એ પેઇન હોય ત્યાં સુધી. Rehab doesn't complete like that. Rehab completes when our muscle bulk is equivalent to normal leg. Rehab completes when we are able to participate in each activity of life to the finest and fullest possible level. It is not a medical thing, it is a quality of life related thing. So most of the time, in most of the places, normal population who is not so much into sports, who doesn't have that ideal physique, still pain lasts or that swelling is real. No, it doesn't go like that. We need to bring this strength back, otherwise rest of the life this is lacking, and this leads to re-injury, further joint damage, early arthritis or life-changing experience in career or game. These are one group of things which discuss. Now another group, that is above 40, osteoarthritis of the knee. Grade 1 arthritis, mild, moderate, severe, very severe. This is the normal joint space. Now when the cartilage layer or meniscus layer here is getting lost or degenerated, two bones start coming closer to each other. As a result of that, weight which is transferred from hip to knee to foot is transferred in wrong manner, and you start getting abnormal discomfort while walking. This is age-related thing we came into. And a lot of other reasons in that. Koikno mobile vaage je, please silent karo, because all other 400 people are getting disturbed. Now, Kanubhai Patel, 68-year gentleman who underwent first knee replacement in 2001. જ્યારે અમદાવાદમાં નવા ચાલુ થયા હતા 95 પછી. He was very comfortable after that surgery. 5, 7, 8 વર્ષ he started getting some rotating movement in the knee joint. He was not comfortable. By 2011 he consulted his operating surgeon. The doc, my knee is uncomfortable. He said we have to re-replace. Understand my word, re-replace. Meaning that implant has to be removed and we have to put new implant. 2011 to 2012, 1 year journey, he underwent 5 times surgeries. 3 time infection, 4th time an implant was supposed to be put inside, bone collapsed. And 5th time everything was fused. So now his right leg is fused, he can only bend with left leg, right cannot bend. ના બજેગા બાસ ના બજેગી બાસુરી, શું છે કહેવત? મૂવમેન્ટ જ નહીં તો પેઇન ક્યાંથી રહેશે? Whereas his wife Shardaben Patel, 2007, 10, 14, 18, 22, at least 5 to 6 times she has taken good physiotherapy for a month or so. At least 85, 90 years, 10-15 minutes ઠચુક ચાલે, life is going good. We are not against anything. જ્યારે જે જરૂર પડે કરવું પડે. Dr. Campbell, the father of orthopedic, very well mentions patientના clinical reportsમાં grade 4 હોય, but more than that, clinically if it is worst, patient is not able to walk 2 minutes even after taking best of the physiotherapy, then we may have to think on that. But patient na knee ma grade 4 hoy, x-ray is showing grade 4 hoy, but patient is able to walk 20 minutes. Do we need to operate that fellow? Not really. We always tell patients, we are treating patients, we are not treating x-ray. If we are treating x-ray, we have to operate x-ray. Why we are operating patient? So the classification is very important, who requires and what is required. Now this is one of the case I would like to tell you. Just before few weeks we saw this patient. એમને ઓપરેટ કરાવ્યું, implant is set very well. She started walking well for a day 1, day 2, and day 3 implant went inside the bone. Can you all see that? Implant has gone inside. Patient presented with horrible pain on day 3. We got x-ray done, this was there, so we said you consult the operating surgeon because physio part was done. When she went to doctor, what he said, તમારા bone weak છે and muscles weak છે. Your bones are weak and your muscles are weak. But that we already knew. So world data says that if somebody wants to undergo surgery, fine, if you are a candidate you may undergo. That will also give you good quality of life, done under good hands. But prepare your muscles well before you plan this. Knee operation is not a bypass surgery where you need to plan tomorrow. So get your muscles strong, get your bones strong, have good nutrition, prepare them, and then if required, let's undergo whatever is required and whatever is most ideal for you. One of the recent evidences we are seeing, which is called hidden data, which you all cannot have access to, even we, some of the doctors are not having access to that data. After 75, and there is a live case I would like to say, Mr. Srikant Vasa, Stanakwasi person from Sangli Gam of Maharashtra state. After 75, a very active businessman, લગનમાં ડાન્સ કરે અને સીટી વગાડે, બધા જોતા રહી જાય એવા હેપનિંગ માણસ. એમને એક સાથે in one go he underwent 2 knee replacements, and immediately what started happening, he started developing neurological condition. Within 6 to 12 months electrolyte imbalance and development of Parkinson set in, and that day and next 4 to 5 years he was completely dependent. Last 2 months back he passed away. Moral is not what happened to Srikant Bhai. Moral is at certain age body do not react well to such external thing happening in the body simultaneously. Everything that we plan has to be well thought, well planned. That is the message. I would like to show this patient of ours who is Hemba Jala, 104-year female from town called as Ankewadia in Surendranagar district of Gujarat. સરસ છે ને, 104 years, 105th is running. એમની આંખો કુદરતી, she has natural eyes, no numbers, no બેતાલા, કોઈ તાલા જ નહીં. Natural knees, she has started getting teeth again. If you do good karma, you get it again. No, after 100, this is the body cycle, not she, many people get that. She would climb 3 floors every day in her town. She has taken physiotherapy. She has made a point to come every year, just 10 to 20 sessions. Her nephew, Lagdir Singh Jala Bapu, tells her that ba તમે કાકીબા ઉપર ના ચડો આટલું. સમજાય છે ને ગુજરાતી? Don't climb up so much, because if you fall, you will get hip fracture, and then who is going to take care of you so much? એ કે મારે તો રોજ 3જા માળે જઈને મારું ગામ જોવું જ પડે, બરાબર છે ને બધું. Another funny part about her is, એમના ગામમાં જેટલા મેરેજ થાય ને એ બધા નવા કપલ હોય ને, આજે જે એક એલિજિબલ બેચલર હતો મારી સાથે ગાડીમાં, સરસ છોકરો છે, શું નામ આપ દોસ્ત? હા, કુનાલ. યા, તો કુનાલ તારું માર્કેટિંગ કરી દીધું દોસ્ત. સો જેટલા મેરેજ કરે એમની જોડે ફોટો પડાવવા જાય કે બા આવતા વર્ષે હશે કે નહીં એમ, પણ બા તો ત્યાંના ત્યાં જ છે, 100 લગ્ન થઈ ગયા આવા. સો ધીસ ઇઝ રિસ્પેક્ટેડ માંડવિયા સાહેબ, રમેશભાઈ. I mean, I could not, he is talking about me, but if I talk about him, I could not judge his age. We thought he must be around 65. But he said I am above 75, 78 precisely. So maybe life you people lived, the generation wise things are changing, and the next coming generation is not going to live that healthy life the way you people have lived. And there are reasons for that, which we all know, the pace at which world is going. But they are inspiring. They are inspiring for all of us. That 104 not out. And not out means living is not issue. How you are living, the quality of life, the function, the movement, the participation in what you want to do, that matters the most. Otherwise what happens, the person keeps thinking 60 વર્ષ સુધી રિટાયરમેન્ટ થઈ જાય, પછી ફરવા જઈશ, પછી ફરવા માટે પગ જ ના બચ્યા હોય. This is not the reality we are all aiming at. Do you know her name? She is called as flower lady of the world. એ કાયમ ફ્લાવર મૂકે છે, અહીંયા મૂકે જ, રોઝ, રેડ રોઝ. You know her age today, as of today? 108 years, 160 days. આજે 159 કે 160મો દિવસ છે, 108 વર્ષ ઉપર એમનો. Because before 2 days, she was 158 days. What is her passion? She is world's first professional 100-meter runner, and she wins. Her records are 1 minute 63 seconds. She wins in these best of the best categories. તો આ લોકો આપણા માટે ઇન્સ્પાયરિંગ છે. એક બાજુ આપણે બિલો 40 ની પેનની વાત કરીએ, બીજી બાજુ વી આર ટોકિંગ અબોવ 40 ડિજનરેશન. સો વોટ ઇઝ ટુ બી ડન? Adopt correct posture, movement, sit, stand, walk. Next 10 minutes we will quickly summarize the knee habits and we will quickly shift to the next topic, because અનંત અંબાણીના મેરેજ નથી થવા દેવાના અને સાચે શીખવાનું પણ છે ઘણું બધું. સો ઓલ ઓફ અસ લેટ સ્ટેન્ડ, લેટ અસ લર્ન ધ આઈડિયલ સ્ટેન્ડિંગ વિચ ઇઝ ધ મોસ્ટ ઇમ્પોર્ટન્ટ થિંગ. હવે તમે જોશો એટલે તમને બહુ હસવું આવશે, કારણ કે આપણે બધા આવી રીતે ઊભા હોઈએ. અત્યારે હું આવી રીતે ઊભો રહી ગયો એકદમ ધ્યાન વગર. લુક એટ ધીસ. This is called as one leg standing posture, and there is biomechanics and science behind it. When we stand like that, one leg is bent, other leg is straight and locked. When one leg is bent, that leg બધા ઊભા રહો આવી રીતે જોઈ લઈએ ને કેવું ફિલિંગ આવે છે. અને ઊભા રહીએ જ છીએ ને રેધર, આપણે આમ ઊભા જોઈએ છીએ ને. સો when we stand like that, એક પગ જે બેન્ડ છે ને, the bend leg muscles are active, but lock leg muscles are not active. So the bone starts turning, the bowing, and the load is on the bone and joint but not on the muscles, and we want it on the muscles. Getting my point? એટલે આવી રીતે ઊભા રહીએ છીએ કે નહીં આપણે? આમાંથી રહેલા છીએ ને ક્યારેક. તો હવેથી આવી રીતે ઊભા રહીશું. ભગવાને કેટલા પગ આપ્યા છે, તો એક ઉપર કેમ ઊભા રહેવું છે? Let's stand on two legs like this. Ladies and gentlemen, this is the most ideal posture where our trunk is straight, shoulders are in line, tummy tucked in, and knee little soft. Knee little soft. થોડા સોફ્ટ. વેન આઈ સે સોફ્ટ, લોકડ નહીં, આવી રીતે લોકડ નહીં, નોટ લાઈક ધીસ. ઓકે, બધા આમ કરો, લોક કરો પાછળ, જેટલાને દેખાય જોઈ લો. સ્ટ્રેટ બેન્ડ કરો સેજ. પણ મારે પ્રેક્ટિસ કરાવી છે, કરીએ. સો લિટલ બેન્ડ and push yourself back. હવે locking is something we want to avoid, so we'll keep little soft, થોડુંક સોફ્ટ. ખ્યાલ આવે છે? we will try to stand like this. એક કામ કરીએ, આગળની 5-6 રો વાળા બેસી જાવ ને, પાછળવાળાની એવી ફીડબેક છે કે એમને નથી દેખાતું, તો આપણે બેલેન્સ કંઈક કરવાનો ટ્રાય કરીએ. પાછળની 3 રો વાળા ઊભા રહો તો તમે મને જોઈ શકો. હવે તમારો વારો. so let's keep it little soft like this. બરાબર છે? પણ when I say soft, it should not happen all our Kisumu friends are standing like this from tomorrow. We don't want to stand like that, but we want to literally keep knee little soft. Muscle ને કામ આપવું છે, joint ને નથી આપવું. Muscles ની capacity ગજબની છે. They are unbelievably strong. I mean, we have to keep it strong, then they are strong. So we transfer the weight on the knee. So આ એક વસ્તુ આપણે જોઈ, આવી રીતે ઊભા રહેવાનું અવોઇડ કરીશું. We will minimize or we will not do it. This is also not done. This is also not done. આમાંથી કેટલા લોકો હાઈ હીલ્સ પહેરે છે? આંગળી ઊંચી કરીએ. બેસી જાઓ, હું ભૂલી જાઉં તો તમે બેસી જજો, વાંધો નહીં. હાઉ મેની ઓફ અસ વેર હીલ્સ ક્વિકલી? કોઈ નથી પહેરતું? બહુ બધા પહેરે છે. સો એનું પોતાનું એક આખું લેક્ચર છે કેમ ના પહેરાય, પણ અત્યાર પૂરતું એટલામાં સમરાઇઝ કરીએ, ના પહેરાય. Just 4 pound of weight loss reduces load on knees by 40 pound. તમારી હાઇટ પ્રમાણે એક આઈડિયલ વેઇટ હોવું જોઈએ. 4 pound meaning load of 40 pound. કારણ કે જ્યારે ની એકલું alternate weight transfer થતું હોય, so one knee becomes, for example, somebody is having 80 kg weight, when my right knee is weight bearing, 80 kg is on right, or left, then 80 kg on the left, but the impact is 40 pounds, that is 10 times higher. So if you reduce 4 pound, you reduce 40 pound impact and you save the knees. Okay. We will avoid deep knee bending for long time. આપણે નથી કરતા ઘણીવાર, જેમ કે આપના knee અત્યારે છે. Your knees are like, so we keep 90 or 100, not, that was 70. So we want to avoid deep knee bending because it troubles patella, knee cap. અંદર જતી રહે ને, so it pushes. Avoid cross leg sitting, 5 મિનિટ 10 મિનિટ વાંધો નથી, long term માટે વાત છે. Avoid Vajrasan, deep knee bending. If somebody has pain in the knee or issue, if somebody is fine enough, कि doc I can do 20 minutes of Vajrasan being pain free, comfortable, कोई तकलीफ नहीं, you must do it. It is fantastic for digestive system and many other things, which our some yoga expert was also here, knows well, and all of us. But not for the person who is having knee issue, specifically patellofemoral issues. Are you with me? Front of the knee cartilage, if they are damaged, there is issue, we cannot do Vajrasan, and we must not do Vajrasan. But otherwise, the rest of the people who are really able to do comfortably, 10 minutes, 5 minutes, you can continue doing so. How many of you wear this or you practice this wearing braces? કેટલા લોકો? કેટલા લોકો ક્વિકલી પહેરી છે ને ક્યારેક તો. So we also have one lecture for the doctors, science of bracing, when to brace, how to brace, what to brace. Dr. Richardson and Paul Hodges have done study in University of Queensland. More than 400 trials are published that whenever you wear external support in your joint like knee or lower back or neck, you are weakening your internal support system. And there is a science. For example, if my kneecap cartilage is affected and I wear this kneecap, I am contrarily damaging my kneecap because I am not allowing kneecap to move properly. It is compressed in the groove, whereas I want to open up from the groove. You are getting my point? So there is a science. If there is somebody is having a ligament instability and we have to provide the support, then there is a different goal. Now what is the story here? Doc told you કે રજનીબેન તમે ની કેપ પહેરજો તમને સારું લાગશે. એટલે રજનીબેને ની કેપ પહેરવાની ચાલુ કરી. પણ રજનીબેન હવે બંધ કરો એવું તો ડોકે કીધું નહીં. તો 10 વર્ષ પછી પણ રજનીબેન તો આની સાથે સેટ છે. This is not that. We want to make our own active support system, passive support system, proprioceptor, everything so strong that we don't need this support. But then there are indications when we need to wear. Then what is to be worn is also science. આ કંઈ over the counter product છે જ નહીં. અને half of the practitioners are not able to prescribe which is the ideal knee support system we should be wearing. Stair climbing is not an ideal physical activity for obese person. Whenever an obese person decides to lose weight, the guidelines should always be followed where his knees are not loaded and planning is done in a way where a lot of things are controlled and in a natural way he loses weight. But sometimes we thought કે ના હવે આજથી તો I had one patient એની હિસ્ટ્રીમાં એવી વાત હતી કે I am shy going to the gym in between lot of people. તો કે મારી સોસાયટીમાં I stay on 6th floor so I go up and down 10, 20 times, 30 times. It's going to damage knees, not allowed. There is a science who is going in which way. In a toilet, squat should be avoided. You know Dr. Shopping? The fourth doctor is always good doctor. The doctor who is meeting you in 4th week because at that time your back pain was anyways supposed to get better. So this is not the problem. Problem is something else. In a year following first episode of back pain, it reoccurs in 90% of patients. Let me explain you quickly classification by Mission Health about the severity, the critical classification. So let me explain. Critical 0 meaning there is no pain. Remember this. Critical 1, mild back pain. Critical 2, severe back pain. Critical 3, back pain travels to leg. Critical 4, back pain travels to leg with so much severity that back pain becomes immaterial, leg pain takes over. Critical 5, leg starts getting weaker, and critical 6, leg gets paralyzed. Can anyone quickly tell me all 6 criticalities? Can anyone tell? कोई कही सकते हैं અત્યારે? એકાદ જણ તો આંગળી કરો. દીપકભાઈ સિવાય. My friend દીપકભાઈ knows everything now. પણ નહીં અત્યારે ટાઈમ લઈએ એમાં. We'll go ahead. So recurrence is the trouble and it becomes more and more severe with each successive attack and this is the state. Mr. Nanji Seshpal, president of Lohana Samaj, Mumbai. 1986 he underwent first spine surgery, 91 second, 99 third, 2011 fourth. હજી સુધી એમનું ઠેકાણું નથી પડ્યું. મિસ્ટર જીવન ભાગ્યોતા, ફાઉન્ડર ઓફ મારુતિ કુરિયર, જેનું અત્યારે બીજું કોઈક નામ છૂટા પડ્યા છે લોકો. I just don't remember the name of the next company. 2006 first surgery in April, infection થયું જૂનમાં, reoperated, 10માં second surgery, 11માં third surgery and then now he has lost all possible hope. ઓફિસમાં બેડ રાખવો પડે છે. So managing director ની ઓફિસમાં there is a couch where he has to sleep every few minutes. Mr. Bharat Shah, Jain, young dynamic businessman, 45-year male, after spine surgery he lost his urine and control. Whenever he enters our chamber he smells because he is wearing diaper. All these stories are real life situations, not just for the sake of telling. And our intention today is to understand the severity of this issue, which is spoiling quality of life beyond imagination. So difficulties in the prevention, ladies and gentlemen, let us learn on our own spine and try to prevent. Let's all stand, and I hope last people will allow first. Let's stand all of us for a while. I am not going to show anything, it will be here. So what is the shape of the spine? Spine is
Straight or curved structure? Only one person raise finger and answer. All of us know that. So how many curves our spine have? ચલો, let us all of us keep our hand in our neck. આપણા પોતાની ગરદન પર હાથ રાખીએ ભાઈઓ. ખાડો છે કે ટેકરો? Concavity. Now we keep hand on our upper back. ખાડો છે કે ટેકરો? ટેકરો. Now we keep in our own lower back. ખાડો કે ટેકરો? And buttocks. કોઈને ખાડો નથી? So there are 4 curves in the human spine. The formula of King says R is equal to n square plus 1. Resistance provided by the spinal column is equal to number of curves in the spinal column plus 1. એટલે કેટલા curves છે આપણી સ્પાઇનમાં? સુરેશભાઈ? આવું કેમ કહો છો? તમારે પણ 4 જ છે. ગરદનનો ખાડો, પીઠનો ટેકરો, કમરનો ખાડો અને બટક્સનો ટેકરો. You have got 4 curves. Are we all clear? કેટલા કર્વ છે બધાને? 4 curve, and then we again become 1 curve. So 1 4 1, 1 2 ka 4, 4 2 ka 1. But how far and how long we are able to make 4 curves is our own strength. એ આપણી સ્પાઇન એટલી સ્ટ્રોંગ કહેવાય. So we understand the structure of the spine: vertebral body, disc, vertebral body, manko, gadi, manko. Disc has got gel in the center surrounded by the outer covering. ગાદીનું કામ શું છે? Cushioning. હ્યુમન બોડી પર આવતા જર્ક ગાદી એબ્સોર્બ કરે છે. આપણે એક જર્ક જમ્પ માર્યો તો યાદ છે? તો નીની ગાદી માટે ફરીથી જમ્પ મારી લીધી. તો કમરની ગાદી માટે, કમરની ગાદીમાં પણ આ જ રીતે ફોર્સ ડિસિપેટ થાય છે. 100 પેશન્ટ બેક પેઇનના હોય ને અથવા નેક પેઇનના, તો 90%માં ગાદી ઇન્વોલ્વ હોય. બીજા 10%માં ફેસેટ, વર્ટેબલ બોડી અલાઇનમેન્ટ, lot of other issues are there. But disc is always involved, either 2% or 90%. Now what is this? This is called as nerve. ગાદી પછી exactly ligament અને ligament પછી nerve હોય. Now tell me, what is the weight of brain? આપણા મગજનું વજન કેટલું હોય? કેટલા કિલો? એક જ જણા ઊંચી કરો, બધામાં હું કન્ફ્યુઝ થઈ જાઉં છું. Not સુરેશભાઈનો 8 કિલો હોઈ શકે. There is one of the fantastic person. I love talking to him. Small jokes keep coming. અને મજા કરાવે. બોલો. No. Anybody else? It is 1200 to 1400 gram. આપણું મગજ 1200 થી 1400 ગ્રામનું હોય. છતાં પણ આપણે એવું કહીએ, ગુજરાતીમાં વાતો કરતા હોઈએ બેઠા હોય કે જેવું જેનું મગજ. Now the extension of brain is spinal cord, which is the most sensitive part for all of us. Spinal cord, I am not talking of spinal bone. I am talking of spinal cord, which is bundle of nerves. What is the weight of spinal cord? If somebody answers me that, there will be a big surprise gift. Except Deepak. Huh? You are very close. Anybody else? 10 એમણે કીધું, કોઈ કે 15 કીધું. So the weight of the spinal cord is just 35 gram. તમે એટલું ઇમેજિન કરો કે 35 ગ્રામનું સ્પાઇનલ કોર્ડ. બધા હાથ ઊંચો કરો, નીચો કરો, પગ ઊંચો કરો. તો આ મૂવમેન્ટ કેવી રીતે થઈ? તમે સાંભળ્યું, તમારા બ્રેઇને સ્પાઇનલ કોર્ડમાંથી નવને મેસેજ આપ્યો અને નવે એનું ટાસ્ક કર્યું. આટલું ઇમ્પોર્ટન્ટ સ્પાઇનલ કોર્ડ ખાલી 35 ગ્રામમાં છે. એઝ અ સ્પાઇન સ્પેશિયાલિસ્ટ અમારા માટે સ્પાઇનલ કોર્ડ ઇન્જરી ઇઝ ઓલવેઝ મોર ટ્રિકી દેન બ્રેઇન ઇન્જરી. કારણ કે બ્રેઇન 1200 ગ્રામનું હોય તો બે બાજુ 600 ગ્રામ થઈ ગયા. કોકને હેમરેજ થયું તો 200 ગ્રામ થયું, 400 ગ્રામ તો બચી ગયું. સ્પાઇનલ કોર્ડમાં ક્યાંક 10 ગ્રામનો ડોટ પણ ડેમેજ થાય ને, પેશન્ટ્સ લાઈફ ઇઝ સ્પોઇલ્ડ બિયોન્ડ ઇમેજિનેશન. So as a spine specialist or neuro specialist, spinal cord injury is more notorious for us to deal with than brain injuries. So let us understand the spine movements. આપણે બધા આપણા નેકમાં હાથ રાખીએ. There is something called as neutral curve. What we will call neutral spine. હવે બધા નીચે જોઈએ તો આપણા સ્પાઇનમાં કર્વ જતો રહ્યો, બરાબર ને? Our curve is getting flat. તો એને આપણે we will call it as flexion. અને હવે બધા ઉપર જોઈએ અને હાથ તો ત્યાં જ રહેશે. તો કર્વનું શું થયું? What happened to the curve? Extension. કર્વ વધી ગયો. So these are the three movements: neutral curve of the spine, flexion and extension. Let us all of us understand and practice. બધાનો હાથ પોતાના નેકમાં હોય. We understand the slight curve, which is called as neutral. Now we all look down, and when we all look down, what happens to our curve? ફ્લેટ થઈ ગયું? નીચે જુઓ. The flattening of the curve is referred to as flexion movement of the spine. Now we all look up and the curve is getting exaggerated. And the curve getting exaggerated, the movement is called as extension. Are we all clear? આપણી ગરદનનો ખાડો હોય એને ન્યુટ્રલ કહેવાય. ખાડો ફ્લેટ થઈ જાય તો એને આપણે ફ્લેક્શન કહીશું અને ખાડો વધે એને આપણે એક્સટેન્શન કહીશું. વી આર ક્લિયર? સેમ વે ઇફ યુ અન્ડરસ્ટેન્ડ લંબર સ્પાઇન, કમરમાં હાથ મૂકો બધા પોતાની. વોટ ડુ યુ ફીલ? Now we all have neutral spine curve. Now we all bend forward little bit. થોડા ફોરવર્ડ બેન્ડ કરીએ તો કર્વનું શું થયું? કર્વ જતો રહ્યો. Now we all look up. What happened to the curve? કર્વ વધે છે, ઘણા તો એક્સટેન્શન કરતા જ નથી. આચાર્યભાઈ ને વિપુલ પૂછભાઈ બરાબર છે. So you are getting my point. This movement is called as neutral spine, this is called as flexion, and this is called as extension. So we are very clear, when our curve is getting flat, the movement is called as flexion, and when curve is getting exaggerated, the movement is called as extension. Tell me one thing, which is commonest site of pain in spine? गर्दन, पीठ, कमर के tailbone? गर्दन અને બીજું લોઅર બેક. સો આપણી આખી સ્પાઇનમાંથી સૌથી વધે પેઇન ક્યાં હોય? તો કે કમરમાં અને ગરદનમાં. ઓમ શાંતિ કર. સો કમર અને ગરદનમાં વધુ પેઇન હોવું એ એક એવી વસ્તુ છે કે કોન્કેવ રિજિયન છે ને, દે આર ધ મોસ્ટ કોમન સોર્સ ઓફ પેઇન. આટલું ક્લિયર થાય છે ને? હવે હું તમને જે સ્લાઇડ બતાવીશ એના પહેલાં આપણે એક મુવમેન્ટ એવી કરીએ. આપણે એટલું સમજ્યા કે ગરદન અને કમરનો કર્વ જ્યારે ફ્લેટ થાય છે ત્યારે ફ્લેક્શન કહેવાય છે. અને ફ્લેક્શન સમજવાનું એટલા માટે જરૂરી છે કે જ્યારે આપણે ફ્લેક્શન કરીએ છીએ ત્યારે આપણી સ્પાઇનમાં શું થાય છે. ડૉક્ટર વ્હાઇટ એન્ડ પંજાબી હેઝ ડન રિસર્ચ ફોર મોર દેન 20 years એન્ડ હી હેઝ શોન અસ ધીસ. જ્યારે કમર કે ગરદનમાંથી વી આર ડુઈંગ ફ્લેક્શન, ધ ડિસ્ક બલ્જ ઓર ડિસ્ક મૂવમેન્ટ ઇઝ હેપનિંગ ટુવર્ડ્સ posterior part, that is backward region, જ્યાં આગળ ligament, spinal cord અને nerves. But whenever we do extension, this is going at anterior place. તો સાદી ભાષામાં જ્યારે આપણી ગરદન અને કર્વ ફ્લેટ થાય, જેને ફ્લેક્શન કહીએ, ત્યારે ગાદીની એબનોર્મલ મૂવમેન્ટ થાય છે. The disc bulge is happening, which is pushing towards spinal cord or ligament or nerve. Are you getting this? This is flexion. હવે મને એટલું કહો, નીચે જુઓ બધા. તો ગરદનમાં શું થયું? ફ્લેક્શન. તો ગાદીનું શું થાય છે? ગાદી ઇઝ ગોઈંગ ટુવર્ડ્સ એબનોર્મલ સાઇડ, ડિસ્ક ઇઝ ગોઈંગ ટુવર્ડ્સ એબનોર્મલ પ્લેસમેન્ટ. નાઉ યુ ડુ ફ્લેક્શન ઇન ધી લોઅર બેક. તો શું થયું? ડિસ્ક ઇઝ ગોઈંગ બેકવર્ડ્સ. આટલું ક્લિયર? So we are able to understand, જ્યારે lumbar flexion or cervical flexion happens, that time disc bulge is happening towards backward aspect, where ligament and sensitive structures like spinal cord and nerve are there. આ આપણે સમજ્યા effect of neck and lower back on the spine. Now let us understand effect of leg on the spine. હાથ રાખો કમરમાં બધા. Raise your one leg. Raise your one leg. And now raise second also. કેમ હસવાનું આવ્યું? બે સાથે કરીએ તો સાવ ફ્લેટ થઈ જાય. બટ વેન એવર વી રેઝ ટુ લેગ્સ, તમે વન લેગ તો ચેક કરો. એક લેગ કર્યો તો કમરમાં શું થયું? કમરનો કર્વ તો ફ્લેટ થાય છે ને? આર વી ગેટિંગ ધેટ? વેન એવર વી ડુ ફ્લેક્શન ઓફ ધ લેગ, it results into double flexion of lower back. Clear? The hip flexion is also harmful for lower back when we are sitting. We'll come to that. હવે એક નાનકડું ટાસ્ક છે. whenever you all will be sitting, તમારી હાથ કમર પર રાખો અને એકદમ ધીમે ધીમે બેસવાનું છે. અને બેસી જાઓ કે એ આખા ટ્રાન્ઝિશનમાં what happened to your cow, you have to tell me. Sit gently, please. શું થયું કમરમાં? બોલો. Flexion, all of you would agree to me? So sitting is flexion, it means sitting is harmful. Are we clear with that, all of us? Chilli lines are clear? If I ask you to bend 200 times, will you bend? Would you prefer to bend? Anyone? Why you will not bend? Because you know bending 200 times is harmful to spine. But what about sitting 200 minutes? Which is most harmful, because without even knowing you are in flexion, and this disc is bulging, and one fine day the outer layer is damaged, gel is coming out. If gel is touching ligament, you feel back pain. If gel is touching nerve, you get leg pain, or from neck you get arm pain. And this pain is not only pain, this can be tingling, numbness, burning, heaviness, different form of symptoms which comes under the classification of radiation, where the source is not the leg, source is back, source is not the arm, source is neck, and then you start getting discomfort in the different regions. So what is the most commonest reason for getting this spine issue? Sitting posture. Quickly આપણે એ learn કરીએ. How do we sit? How much time we spend in sitting posture every day? We spend 50% of life in sitting posture. Yet we don't know how to sit. Most of us sit like this, flat. Or the most favorite posture of all of us, which is also posture of flexion. And oh, look at this guy, or this lady, or him, or him, or him. All four curves are getting converted into single curve. The spine curve is flat. We are losing the resistance, and this bulge is happening. See this slouch posture. For this single curve. When four curves are converted into single curves, our resistance level comes from 17 to 2. So look at this. हमने तो कोई संबंध नहीं है चेयर साथ. So much occupied in the work where he has not been able to take ideal support. અને હવે પડે તો શું થાય ખબર છે, કમરને ગરદન તો છોડો, ટેલબોન ઉપર આવે. So, when we sit in the chair for long duration, muscles don't support the spine, ગાદીનો nutrition hamper થાય, and nucleus jet પાછળ it gets pushed towards backward aspect where all the sensitive things are lying. And finally, understand one curve versus four curve. And this whole phenomenon happens where disc is touching the nerve and we start getting symptoms. So there is no hope of curing back pain if we continue to sit incorrectly. What are the factors responsible for wrong sitting? One is faulty workstation. આપણે જે ચેર પર બેસતા હોઈએ એ ખોટી હોય, ઓફિસની ચેર ખોટી હોય, અથવા પોરલી ડિઝાઇન ફર્નિચર એટ ડોમેસ્ટિક. ઘરે કોના ઘરે એકદમ પોચા ડનલોપ સોફા છે આપણામાં અહીંયા? હાઉ મેની ઓફ અસ હેવ ડનલોપ સોફાસ? એકદમ પોચા તો હશે ને કોઈના ઘરે, છે ને? કેવા કે આપણે બેઠા એટલે અંદર જતા રહીએ વખત તો મારે ઘરે અવાય તમારા ચા પીવું છે ડનલોપના સોફા? ક્વિકલી કેટલા લોકો? So that is the worst thing we can do to our spine, because the surface which cannot support us is not ideal for us. એ સોફાને આજે કાઢી અને ગેસ્ટ રૂમમાં મૂકી દો, બિકોઝ ગેસ ક્યારેક જ આવે ને, એટલે ગેસને ના આવવાની ના નથી ફરવાની, પણ એને ક્યારેક જ આવવાનું, આપણે રોજ બેસવાનું. So this is a family inflection. This guy is watching football as if he is playing football. This guy doesn't have any relation with the chair. Or this is the worst posture, where spine is in flexion at the lumbar level, and effect of hip and knee also is damaging knee, damaging spine. See this, or this, or this. So let us learn the ideal sitting posture. Can anyone tell me કેવું હોવું જોઈએ? Ideal posture કોને કહેવાય? Can anyone tell me? કોઈ મને બતાવી શકે please? So ટટ્ટાર, on your ટટ્ટાર ને એકદમ બેસો ને ટટ્ટાર એકવાર, બધા ટટ્ટાર બેસો, સહેજ આગળ આવી જાઓ ચેરમાં, અડ્યા વગર પાછળ થોડાક આગળ આવી જાઓ ચેરની. હા યસ, હવે ટટ્ટાર એકદમ, ટટ્ટાર ટટ્ટાર એકદમ ઇરેક્ટ. હાઉ મેની મિનિટ્સ? આપ તો સ્લાઉચમાં જ છો. આપણા ચેરમેન સાહેબ, શું નામ? He was the youngest chairman, right, as we referred in the morning. શું નામ આપનું? ગુરદીપભાઈ. તો ગુરદીપભાઈ ટટ્ટાર બેસી, કમ, અને એકદમ ટટ્ટાર બધા, એવરીવન, એન્ડ વિધાઉટ ટેકિંગ સપોર્ટ. સપોર્ટ લઈને વાત જ નથી. જો આપણા સુરુભાઈ બેઠા છે ને, એકદમ એવા ટટ્ટાર. So this is called as military-like posture, right? As rightly said by somebody from our own audience, that Tattar is the ideal posture. But tell me one thing, કેટલી મિનિટ આપણે આ પોસ્ચરમાં બેસી શકીશું? 10માંથી 5 થઈ. શું નામ આપનું? પંકજ ઉધાર કે પંકજ ઉધાર શું નામ ટટ્ટાર બેસો સો પંકજભાઈ will sit for 10 minutes ટટ્ટાર and rest of us will continue the workshop so let us imagine a profession જેમાં ટટ્ટાર બેસવાનો સેલરી મળતો હોય you sit ટટ્ટાર and you get salary there is CCTV camera you punch in sit 8 hours ટટ્ટાર go back punch out and your salary is the minute you don't sit ટટ્ટાર the salary is cut imagine the profession like this તો પણ આપણાથી ટટ્ટાર ના બેસાય કારણ કે જેવા આપણે બીજા કામમાં પાર્ટિસિપેટ કરીએ ધ મિનિટ વી પાર્ટિસિપેટ ઇન અધર ટાસ્ક he lost our cut so let's understand these four postures ચોથા નંબરનું પોસ્ચર ગુરદીપભાઈ અને આપણે હવે ગુરદીપભાઈ તરીકે કરું કારણ કે મેં ગુરદીપભાઈને સડનલી એ પોસ્ચરમાં જોઈ લીધા અને હું પણ બેસતો છું નથી પણ 2 મિનિટ 5 મિનિટ લોંગ ટર્મ યુ કેનોટ સીટ ઇન ધીસ પોઝિશન સો ધીસ ઇઝ fourth number slouch posture yes or no huh who said yes or no હવેથી કાલથી બેસીશું કે નહીં તો નો સંભળાવવું જોઈએ ને મને ઘણા લોકો અંદર અંદરથી કહે છે યસ ધ થર્ડ પોસ્ચર વિચ ઇઝ સ્લમ પોસ્ચર જેમાં આપણું આખું ફ્લેટ થઈ જાય વી વોન્ટ ટુ અવોઇડ ધેટ ફર્સ્ટ વન વિચ ઇઝ મિલિટરી લાઈક પંકજ ઉધાસવાળો પંકજભાઈ stay erect now what we will find is not first not third not fourth we will do second બધા ટટ્ટાર બેસો અને પાછળ જતા રહો like he said 90 90 90 go back in the chair we remember this formula called as BBC Sagar show everyone BBC meaning buttocks at the back of the chair આપણા બટક્સને પાછળ પુશ કરો how જેટલું બને એટલું push backward push yourself backward stay erect and go back as much as you can now you should not be leaning you take your buttocks at the back of the chair get it buttocks at the back of the chair sit erect and then support on the now the rule of the legs hip and knee should be at the 90 degree hip and knee should be at the 90 degree knee can be lower than hip but knee should never be higher than hip પેલું આપણે નહોતું જોયું અંદર બેસી ગયા હતા so buttocks at the back of the chair spine erect and then leaning on the back support hip and knee equal feet supported knee should be at the hip level knee can be lower than hip but knee should never be higher than hip this is all good fantastic શું નામ આપનું દિનેશભાઈ કેવા પંચાલ કયા ગામના So we will assume the second posture called as relaxed erect posture. First cross, third cross, second yes. This is about the chair. Either chair can be flat or chair can be convex, but chair should not be concave. This is forward head posture because of use of lot of mobile and computer. We are leaning forward and we start developing the hump or cervical headache. આપણે માથાના દુખાવા તરીકે કમ્પ્લેન કર્યા કરી પણ પ્રોબ્લેમ પોસ્ચરમાં હોય સો ધીસ કેન બી ટ્રીટેડ વેરી વેલ વિથ સમ એક્સરસાઇઝ આઈ કેન ટીચ યુ રાઈટ અવે ઓલ ઓફ યુ કીપ યોર હેન્ડ ઓન યોર ચીન એન્ડ જેન્ટલી ટક ધ ચીન હોલ્ડ ઇટ 1 2 3 4 5 6 7 8 9 10 and relax this movement has to be gentle this cannot be forced movement this has to be very very gentle movement yeah and we are not looking down in the same plane we are doing this tuck this will help us to see this is wrong this is right so this is some video which shows us ideal sitting posture and whenever we decide to sit and go in office we think we'll sit nicely but as time goes we keep doing a lot of wrong stuff બધા આમ હાથ રાખીએ This is one of the work principle. પંકજભાઈ કેટલી વાર આવી રીતે હાથ રખાશે અમારે એક આવા જ પંકજભાઈ હતા કોઈ વર્કશોપમાં એમણે મને કીધું જેટલી વાર કોઈ એટલી વાર તો આખી વર્કશોપમાં પંકજભાઈનો હાથ આમ જ અમે બધા વર્કશોપ ચલાવતા હતા સો we cannot sustain this posture for long duration. Reason is this is anti-gravity posture where our distal joint is against gravity. So whenever you work on a computer or desk, this is not an ideal posture. Your height of the chair and desk should be aligned in a way પતિ ગયું આટલી જ વારમાં આપણે તો પંકજ 10 મિનિટ કરવાનું. સો વી વિલ નેવર ડુ ધીસ, વી વિલ ઓલવેઝ કીપ ઇટ લાઈક ધીસ. હવે આમ રાખો. સો વેન એવર વી વર્ક ઓન, રમેશભાઈ આમ, વી વર્ક ઓન ધ ડેસ્ક, ધ રૂલ ઇઝ elbow should be lower than shoulder, wrist should be at the level of elbow or lower than elbow. આ બધી નાની નાની વસ્તુ છે, પણ if we start taking care we can avoid lot of issues. Please, thank you. Sagar, can you please? So this is wrong where knee level is going above hip level. And all four curves of the spine are converted into single curve. One of the worst posture for long-term working. Screen height, lot of wrong postures we keep assuming throughout the day. 6 hours in the office, 8 hours in the office. Now let's learn ideal. Tomorrow when we go to our work, Monday morning, we adjust our chair height. We put some lumbar support in chair is ideal. Buttocks at the back of the chair, hip and knee at the equal level. Back of the knee should not be touching front of the chair ever. Equal distance, the distance between computer and eyes should be at least 1 arm. Computer screen should be put in a way where your neck doesn't go too much extension or too much flexion. So this is something which we quickly understood. We'll shift to the second important thing called as frequent bending. How many times in a day we bend? દિવસમાં કેટલી વાર વાંકા વળીએ છીએ? 20 times or 30 times, 40 times, 50 times, 100 times. Whenever our neck is straight, the muscle has to work 25 and versus whenever it is bent, muscles have to work 100 and. There is a new epidemic called as tax neck. Corona has gone, but this is here to stay. Tax neck syndrome, very new term. How many of us here are on social media, Instagram, Facebook, LinkedIn or YouTube? Instagram? Once this is done, let's connect over the Instagram at Dr. Alap Shah or Mission Health Official or Facebook or YouTube, where this video is something you must share with every relative you know is using access mobile or access screen. Let's see this.
Neck and shoulder postures during texting for prolonged hours of their smartphones. A newly coined term, text neck syndrome is an overuse injury or repetitive stress injury due to prolonged hours of forward neck bending over the smartphones, laptops, iPads, etc. The cervical spine in neutral position has a mild concave curve. In this neutral position, the weight of the head is 10 to 12 pounds for every 1 inch of the head moving forward away from the neutral posture. The forces on the cervical spine gets doubled. At 45 degrees of neck tilt forwards, the weight on the cervical spine is around 49 pounds. Taking other way round, the neutral head posture requires 25 Newton muscle forces to balance the system, and forward head posture requires 100 Newton muscle forces. Hence, increasing the demand from cervical and shoulder builder muscles 4 times. Forward head and neck posture can cause permanent damage and result in text neck syndrome, which can lead to neck pain, shoulder pain, upper back pain, slip disc, tingling, numbness and weakness in the arm, awkward posture, cervical headache, etc. The problem is really profound in young people who are excessively using smartphones and other gadgets. Hence, to prevent this newly emerging epidemic, Mission Health spine experts suggest to maintain cervical spine in neutral zone. Take the smartphones to eye level instead of bending head and neck forwards and minimize the use. Most important, do cervical extension, 10 counts 3 to 4 times per day. have a healthy spine.
Even when we bend our spine more than 45 degree, we have put EMG electrode on the spine and tried to study the muscle work, and we could really see the muscles don't support beyond 45 degree. So beyond 60 degree or beyond 90 degree when we are bending, our spine is at risk, 30% less strong. Let's look at our own day. How many times in a day we do flexion and how many times in a day we bend? So 2 pillows are cervical flexion. This is one other trouble in life now. She is the governor of this county, so morning she has to check what has happened. All 4 cows convert single cow, lot of flexion throughout the night, lot of wrong postures. When you have pain and stiffness in the neck or lower back in the morning, either your surface of sleeping is wrong or your posture of sleeping is wrong. We cannot blame anything. This is the first flexion of the day which all of us do and we are allowed to do. But there are series of other flexions that we will be seeing. ઘણા લોકોને બ્રશ કરવાની એવી આદત હોય ને, પેલા રામુ કાકા ટંગ ક્લિનિંગ ચાલુ કરે તો બાજુમાં ખબર પડી જાય. ઘણા લોકોને આ બહુ સ્ટ્રોંગ રિલેશન હોય, ન્યૂઝપેપર હોય ને તો જ આ એક્ટિવિટી થાય. એટલે લઈ શું થાય કે 5 મિનિટનું કામ 15 મિનિટ ચાલે. એટલું કમર પર ફ્લેક્શનમાં જોઈએ ને, કોઈ ત્યાં તો એક્સટેન્શનમાં બેસવાનું નથી. હે પંકજભાઈ, ત્યાં તો એક્સટેન્શન કેવી રીતે થાય? This is also slouch posture. Gurdeep bhai, all well? So many flexions throughout the day. Even before you go to office, 10 flexion they are wearing socks. તમે કારમાં બેગ મૂકી, look at this, wrong placement. Or sitting in the car, આમાં શું wrong છે? What is wrong here? This is double flexion. Knees are higher than the worst thing ever. આપણામાંથી કેટલા લોકોએ એવું ફીલ કર્યું છે કે whenever you sit for 2 hours and then when you stand you literally adjust your spine and then you stand. Can anybody tell me science behind it, mechanics behind it? Huh? Yeah, that's the reason. But what happens inside the spine? Generally, they એવું થાય. Yeah. Please explain. See what happens when you sit long, this gel is pushed backwards. But when you stand, this gel will be pushed. And that backward to forward is a hydrostatic thing. Doesn't happen like so. It takes little adjustment and that is why we feel uncomfortable. Or driving a bike with a this is single curve. So all the resistance is doing yoga for the sake of satisfaction. This needs to be done with proper guidance, proper postures. આ કોના માટે કરે છે એમને જ ખબર છે. For whose satisfaction this is going. For anything you see the flexion. આ ભાઈ જીમ પહોંચ્યા તો ચલો જઈને મસ્ત એક્સરસાઇઝ કરીએ. Lifting up a kid or going to gym. Now what is wrong here? Already the disc gel was at the peak of the damaging threshold. He went to gym, bent 180 degree, 3 things happened. 4 curves are converted into single curve, so resistance level came from 70 to 2. He was in flexion, so more backward movement was pushed. And third, if you remember, when you bend above 60 degree, muscles are not supporting, we are dependent on ligament and connective tissue. So 3 aggressive forces, and fourth one was 10 kg weight. To disc rupture and gel is out touching cord and nerve. We had done this campaign in 2019 before Corona in Ahmedabad called as O Ma Mari Kamar. કમરના દુખાવામાં પહેલા યાદ આવે માં અને પછી મિશન હેલ્થ. Fantastic campaign we did. We have treated many young boys who were suffering from slip disc issue because exercises like deadlift or some wrong movements in the gym took them to this place. So this is something which needs sincere attention. See this. For anything, we keep assuming wrong postures throughout the day. Maybe in the kitchen, 4 curves converted to single curves, flexion beyond 90 degrees, freeze or drawer or so many things we keep doing. Neutral to extension, extension to neutral. We are not talking anything else. I want you to keep your finger in the neck, yes, like this, so that you can literally feel what is happening to your neck. Look up, sir, yes, come back to neutral, neutral, come back, very good, and look up. And નીચે તો જોવું જ નથી ભાઈ આપણે. શું નામ આપનું? અજય ભાઈ, will not look down. Come back to neutral, look up. Dr. Sagar, you are seeing other people. Look up, come back to neutral. All of us simultaneously look up, cervical extension, and come back to neutral. શું કરો ભાઈ, મજામાં છો ને? Come back to neutral, look up, and come back to neutral. Now lumbar extension. All of us keep our finger in the lumbar spine. What's your name, buddy? Take one photograph from there, where you can take all of us together. Maybe you may go on the stage. So all of us will be doing this extension, and this has to be very, very gentle, fantastic movement realization where you are moving L1, L2, L3, L4, L5 and coming back to neutral. While doing this, we are literally sending disc gel towards its original position, and we are preventing back pain from happening. I can bet if I give you 100% guideline, and even if you follow 80%, you will never have to go to a doctor. It's not a good deal. So let's keep our finger here and do lumbar extension where neck is normal. You are doing very gently this movement, only at the lumbar region. Look up. This is okay. We're not moving this here. So many of us, I can see, are not able to do lumbar extension. Why? Because our spine is already locked in flexion. But good news is, if we try to do, so bhai, what's your name? Bharat bhai પેટ બહાર કાઢે છે. So it's not, એમનું પેટ એટલું છે જ નહીં, થોડું ઘણું છે, પણ what's happening is, in an attempt to do lumbar extension, he is pushing pet forward. We don't want to do that, yeah? We want to do L1, L2, L3, L4, pure lumbar movement. And very slowly you are going it. This is really art. And I can promise that communicating with more than 7 lakh people, we have the data which clearly shows that you follow this, your spine is good. Because you are following a science. The workshop name is Balance the Ergonomic Workshop, meaning you are balancing the demand of your body by specific postures. So one more time we do lumbar extension. 1, 2, 3, 4, 5 and coming back to neutral gently. Right chair? હવે we'll do one more exercise which is called as auto stretch. હવે એ બધા તો નહીં કરી શકે, પણ you do પોતાની જગ્યા ઉપર will take this shoulder up. હવે જેટલા લોકોને વોલ મળે છે ને, થોડાક લોકો વોલનો સપોર્ટ લઈ લો ક્વિકલી. કમ ટુ ધ વોલ, ટચ ધ વોલ. થોડાક લોકો જ કરી શકશે. Somebody can, it's a fantastic activity. Dr. Sagar would demonstrate once. Sagar, can you demonstrate? Your heels should be touching the wall. Your heels, feet should be touching the wall. Your shoulders should be touching, your hands should be touching the wall. Now you elongate yourself, stretch up. Now push the hand and push the feet as if a diwal padi devan. So what we are doing is, feet is touching the wall. This exercise we all will be performing at home. This will activate our anti-gravity muscles. And I am coming too close to speaker. So heels touching the wall, hands touching the wall back, and push from the hand and push from the feet and elongate, stretch yourself up and continue doing deep breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and relax. How is the Josh? છે જ નહીં, કોઈ અવાજ જ ના આવ્યો યાર, આવું આપણું કિસ્મોનું. How is the Josh? See, આનું સાયન્સ બહુ સિમ્પલ છે. We told whatever theory we are explaining, there is a practical science. 1 cow to 4 cow to 1 cow. We want to maintain 4 cows. And this is the most advanced science, જે બેઝિક આપણા પીટીની એક્સરસાઇઝમાં આવતું હતું. પણ આને આપણે યુઝ કરશું તો એકદમ all anti-gravity muscles are. So all of us will do it one time. Whosoever are lucky enough to get the wall, touch the heel, touch the hand, push the hand, push the feet, elongate, stretch yourself up and deep breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and relax. Please have a seat. So we understood 2 things. આપણે બે વસ્તુ સમજ્યા. બસ વધુ આવતા અંકમાં, સાગર, વધુ આવતા અંકમાંનો મતલબ શું થાય માંડવિયા સાહેબ? રમેશ અંકલ, we'll do it later because lot to learn. So cervical extension 10 times in the morning, lumbar extension 10 times in the morning and auto stretch 10 times in the morning. All of us will start doing. Foot curl, 4 exercises we have learned so far. Now we'll understand predisposing factors were prolonged sitting and forward bending. But precipitating factor, પેલા બંને મુખ્ય કારણ હતા, but then you need a little push. Can be any movement which is unexpected, unguarded, which can cause sudden pain. It can be just lifting a pen or lifting up a baby. Now this is lifting technique. Very important. અમે આનો લાઈવ ડેમો કરતા હોઈએ છીએ. ઇટ્સ અ પ્રેક્ટિસ. સિન્સ આઈ વોન્ટ ટુ ટીચ યુ સો મચ, લાઈવ ડેમો નહીં કરીએ પણ જોઈ લઈએ. Whenever we lift any object, there are 2 options. Either we bend 180 from the spine or we do 3 things. Little knee, little hip and then lower back. So we divide it. Understand this. This is completely wrong. આ મગજમાં બેસાડી દો. ઓકે, આમાંથી બધા WhatsApp ઉપર છે. ક્વિકલી એક નંબર સેવ કરશું કે મોબાઈલ હમણાં ખિસ્સામાં જ નથી અડવું. +91 9081 ખાલી ડાયલ કરી દો ને, સેવ પછી કરજો. +91 9081. ગૌરવ, સાચો નંબર છે ને? 110110. Now you just put a request that you are from the Hindu Council of Kenya Kisumu branch and you need soft copy of this ideal posture. Then within 1 week you will receive the soft copy of entire 20 book, which you can circulate in your family, friends. It is because a lot of heavy files we will not be able to send by video.
You can just announce that it's on the poster. You can announce that it's on the poster.
It's on the poster, number is on the poster, but you can save it right away. +91 9081 110110. Done. We'll quickly see here again. Now look at this. Sorry, I brought the disturbance in between, but it was important because I want to send this book to you, which should be with you for rest of the life. This is wrong and this is right. And always remember, when you lift some object, you should be close to the object, you should be in front of the object. Gurdeep Bhai, BBC, buttocks at the back of the chair. I want you to come to Ahmedabad, meet us, have dinner with us, see our center, but I don't want you to come to us as a patient. Buttocks at the back of the chair, hip and knee equal level, feet supported, neck neutral. Lifting rule is airport પર ઘણીવાર આપણા ઇન્ડિયા કે કેન્યાવાળી હોસ્પિટાલિટી બીજી જગ્યાએ નથી. We all know that. આપણા લોકોની હોસ્પિટાલિટી અનબિલીવેબલ છે. Whether we talk of India or Kenya. You are in some other part of the world where you are lifting 30 kg weight on your own. At that time you need to use proper technique. You should be in front of the object. You should be close to the object. Bag અહીંયા હોય તમે અહીંયાથી લેવા જાઓ is not done. You have to come here right in front and close to the object. So when you keep the object close to your body, the load on the spine is less. And for the school children, very strong advice, never one-sided backpack, always two-sided backpack. Very important. What is better, pushing or pulling? Pushing સારું કે pulling? Why? Because આમાં લખ્યું છે. Pushing is better because abdominal muscles are used. Pulling is wrong because small back muscles are used. How many of us use two pillows? કેટલા લોકો બે ઓશિકા ફટાફટ? કેટલા બધા લોકો આ ફોટો પાડો આટલા લોકો કરે છે. આ બધાને આપણે લખી દો નામ. We can't use two pillows. Why? Because દિવસ ભરમાં we do so many flexion. Then why in night we do flexion? We have to be in neutral. We have to use thin pillow, firm pillow and single pillow. If you sleep supine, straight. But by chance if you sleep in the side, then you have to use two thin pillows. What about mattress? કેટલા લોકોના ઘરે ડનલોપની મેટ્રેસ છે થોડા ક્યાં મૂકીશું હવે? ગેસ રૂમમાં. Dunlop mattress, why not allowed? Because as soon as you go in Dunlop mattress, you totally go inside. Your entire spine goes into flexion. Your 4 curves are converted into single curves. So this is the worst possible posture we can have. The ideal surface is firm. So they say, sleep like you stand. Please stand, all of you. While we are standing, one of the golden rule, unbelievable. Don't forget that every 30 minutes, wherever you are, just change your posture. You will remember me. A lot of government ministers or officers, when I teach them this, they say that doctors have important meeting માં હોઈએ તો કેવી રીતે ઊભા થવાય? When I say them, નરેન્દ્રભાઈ ઊભા થાય છે, તમે કેમ ના થઈ? Every 30 minutes we have to change posture. Because when you change posture, you are bringing your spine from flexion to neutral. You are giving nourishment to your disc. You are giving conversion from single curve to 4 curves. So why to? અને બીજું શું છે, કોઈને ઊભા થવા સામે વાંધો નથી, but there is a barrier. બેઠા છીએ અને બેઠા તો એવા બેઠા કે 4-4 કલાક બેઠા રહે. Absolutely not allowed. Every 30 minutes we need to change the posture by any means at any cost. જ્યાં પણ હોય ત્યાં ટ્રાય કરવાનો. કોઈક વાર વધુ ઓછું is okay. So we want to change our posture. Now when you stand, you can feel 4 curves. Same way when you sleep, you have to have 4 curves like this: neck, upper back, lower back, and buttocks. So when you buy a mattress, you should not buy it online. How on the world we can order mattress online? તમે કાર ઓનલાઈન ઓર્ડર કરો છો કે એકવાર ટેસ્ટ ડ્રાઈવ તો લીધા વગર કોઈએ કાર લીધી આખા રૂમમાં? કોઈ પણ કાર લીધી લાઈફની ફર્સ્ટ કાર કે બેસ્ટ કાર કોઈએ ટેસ્ટ ડ્રાઈવ કર્યા વગર લીધી? કોઈ હશે એવું, પણ બહુ ઓછા. Mattress cannot be ordered online. Ideal method of ordering mattress is go to the shop and sleep on the mattress for 10 minutes. What is not allowed? Here? Where it is not allowed? They don't allow. We can change. ક્રાંતિ કોઈકે તો લાવવી પડશે ને, બાકી અમે તો લાવી દીધી છે. અને ઇટ ઇઝ એટલે એક ઇન્ડિવિજ્યુઅલ કોઈ કંપનીનો પ્રોબ્લેમ પછી ડિસ્કસ કરીએ, બટ આઈડિયલી યુ શુડ ડુ ઇટ. This is something which is very important. We should always buy firm mattress. Mattress should be not too soft, not too hard. Same way pillow, not too soft, not too hard. આપણું રૂનું દેશી ગાદલું હોય ને, it will also do, but it should be firm. And if you are buying a new mattress, remember these numbers. Firmness density of mattress has to be more than 4 to 6. Softness density has to be less than 5. Some numbers are there, but still we can give you more guidance. And by chance, if you happen to sleep on the side, use 2 pillows, thin pillows, or you may keep 1 pillow between the knees. Are we clear? Please have a seat. Because otherwise what happens, you use whatever mattress you spend so much, we are not going to get the effect. Because our spine is not as flexible as this. આપણી સ્પાઇન આટલી ફ્લેક્સિબલ છે જ નહીં ભાઈઓ. These are the pressure in the spine in different position. Dr. Nelson explained us the pressure within the disc. ધારો કે સુવામાં 25, સાઇડ લાઇનમાં 75, સ્ટેન્ડિંગ is 100 and sitting is 275. So this is one of the, sitting is like new smoking. You have to keep changing the posture. Standing is something very important. જે લોકોને બહુ ઊભા રહેવાનું આવતું હોય, they should keep this platform. These are some of the pitfalls of back pain treatment in India or many part of the world. સૌથી પહેલા diagnosis. How many of you are aware with the word spondylosis? So spondylosis is the definition wise fixed non-reversible degeneration of the spine. ઘસારો. હવે મને એક લોજિક આપો સુરેશભાઈ. આજે તમારા એક્સરેમાં સ્પોન્ડિલોસિસ આવ્યું અને તમને પેઇન છે. અઠવાડિયા પછીના એક્સરેમાં પેઇન નથી, પણ તમને પેઇન નથી, પણ એક્સરેમાં તો સ્પોન્ડિલોસિસ હશે જ. યુ આર ગેટિંગ માય પોઈન્ટ. Spondylosis cannot be treated. What can be treated is the source of pain, which is muscle or facet or ligament. These are the missed terminologies. Medication is something very important. We strictly want to avoid painkillers or steroids, because medicine is not a targeted treatment. It has temporary effect with lot of side effects. And steroid we want to strictly avoid. Post-COVID, due to long steroid intake, we have been suffering with this issue called as avascular necrosis of hip. આમાંથી કોઈ છે કે નહીં ખબર નથી. It's a condition where blood supply to the hip bone is compromised. Hip bone gets dry, collapsed, compromised, and gradually 25, 30, 35-year boy or girl, they are advised surgery of hip. We are saving so many surgery with the new technology by which we can improve blood supply to the hip joint. But the moral is, it is the side effect of steroid. We must avoid. Inappropriate surgery. Spine surgery is not something, આંખનો મોતિયો ચાલે, હૃદયની bypass ચાલે, but spine is not something that we would want to touch. એના પોતા, if you do if you do simple laminectomy, spine would develop instability at some point of time. If you do screw fixation, there is a challenge which we'll discuss. And finally, it's all in your mind, we'll talk on that. This is very important line I would like to tell all of you. My aunties benefited with this yoga, so I will also do now. દરેકના યોગા કયા હોવા જોઈએ અથવા તો એક્સરસાઇઝ કઈ હોવી જોઈએ એ અનુકરણ આંધળું ના હોય, એક સાયન્સથી હોય. ફોર એક્ઝામ્પલ, ધીસ ઇઝ ધ આસન કોલ્ડ એઝ ભુજંગાસન, રાઈટ? ઓલ ઓફ અસ, which is fantastic asana for most of us in this room. But there is a condition called as spondylolisthesis, જેમાં એક મણકો બીજાની કમ્પેરિઝનમાં the one vertebral body will move forward in compared to another. In that condition, if you do this exercise, if vertebral body is moving 25%, in some time it will move 40%. Now this was an X-ray of one doctor who had grade 1 problem. After 1 year X-ray, she developed grade 2. So we asked her simple question, what did you do in 1 year? Grade 1 to grade 2 is 25 to 50% damage. Otherwise 10 વર્ષ પણ અમે એને ઓપરેટ ના થવા દઈએ. Then she told, I did Bhujangasana 200 times in a day. Looking at my friends, Bhujangasana is bad? No, it's fantastic asana. But કોના માટે કયું અલાઉડ છે? It's a real science. So પછી સ્ક્રૂ નાખવો પડે. Now what happens? The challenge starts. અગર અહીંયા આપણે સ્ક્રૂ નાખી દીધો L5S1 માં, L5S1 will stop functioning. એનું 20% વર્ક હતું. Why 20%? Because L1 to L5 20 work contributed. When L5 is locked, the entire load is on L4 L5. Within 2 years, we will see L4 L5 behaving in the worst possible way. So we must avoid surgery so far as possible. So these are the type of pain, chemical and mechanical. If somebody has infection in the spine, or somebody has inflammation, or somebody has arthritis, we may think of medication. We don't even think of that now because there are several other causes we need to identify before we start taking anti-arthritis medication. But that's a chemical pain. But whatever pain we are talking today in this room is mechanical variation, physics pain, wrong posture. So does mechanical pain require chemical treatment? Yes or no? Yes or no? What does it require? Regular spine exercise, regular spine strengthening, regular posture check. We will list things. And when you follow that, you don't need this unnecessary medication or steroid injection or surgery. One of the very good research friends in Australia called as Kathy and Linda, they have done fantastic research about thoughts. Surubai, આવું ના કરો યાર, ખોટું લાગે મારાથી? ખોટું લાગ્યું? સીધા બેસી જાઓ. So here we are. Kirill Nigar did fantastic research on mindset. 500 જણનું એવું ગ્રુપ લીધું જેને ઓપરેશનની જરૂર હતી, એને ઓપરેશન કર્યા. 3 મહિને અને 6 મહિને ક્વેશ્ચનર પૂછ્યા. After 3 months and 6 months the question was asked after spine surgery to 500 participants. How do you feel? The question and the answer was wow, fine, we are very comfortable. She took another 500 people group who never required surgery but they were suffering with chronic pain and thought processes for 6 months, 1 year, 2 year, 5 years. They took in the operation theatre, put the incision and packed it as if operation is done, but operation was not done. After 3 months question was asked, after 1 month question was asked, after 6 months question was asked, how do you feel? Most of the people answered that, wow. So, it's all green વાળું on the left, cancel. See, all 4 curves are maintained, there is no need of flexion. 90-90, well maintained. Straight versus absolute abnormal. See, this is such important activity. Rather than bending forward, you are tall, lifting it proper and pushing it proper. See this. All 4 curves maintained versus wrong. And now see the same person sitting in flexion versus you will see sitting ideal. Adjust your chair. Take the chair as much back as possible. Increase the height. Leg space has to be proper. Hip and knee equal level. Again, hip and knee equal. All 4 curves maintained versus absolute wrong curve. Our team has done immense effort to make this presentation. Immense effort to show you right, wrong and right. Single curve versus 4 curves. Bending versus walk lift. Lifting the kid in most ideal position. Releasing. Whosoever is going to gym or exercise, you have to remember this rule. Whenever you contract, it's okay. Whenever you relax, the release phase has to be very, very gentle. If it is forced, it is damaging. Look at the difference. He is going into total flexion versus he is in neutral. See this. Deadlift done right versus deadlift gone wrong. That ambitious deadlift which can be harmful to us for the rest of the life. For anything, lifting up thing in a drawer with most ideal posture. Can you see this? For lifting up tel ka dabba. For so many things. So, finally ergonomics applies to whole body. Drinking good quantity of water, brushing 2 times a day, having less threshold to get angry on someone, sleeping properly, for everything. It should not so happen down the line when you have all possible thing in life, best possible luxury, but you are taking 10 medicine in the day or you are repeatedly hospitalized for the problem. I would like to teach you this breathing exercise called as diaphragmatic breathing. Diaphragm is the major muscle of respiration. All of you sit in your own chair and put your hand on the abdomen. When I ask you to do deep breathing, your breathing should not be to upper chest, it should go deep towards the abdomen. Our abdomen should come out, bulge out. Then we will hold the breathing. So all the alveoli will open and then we will release. Let's start doing it. Breathe in. Hold and relax. My only objective is to teach you proper diaphragmatic breathing, which is very important muscle of respiration, which will give us so many advantages. Breathe in, hold it, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and relax. So we are adding to the list, all of us. Breathe in, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and relax. Chest should not come out. We are talking of abdomen bulge. સાદા બધા બરાબર કરી રહ્યા છે કે ચાલે એવું છે? કોઈકને પણ ચેક ને રેન્ડમ એનીવન. Are we all okay? નથી થઈ રહ્યું છે. કેટલાક લોકો ચેસ્ટ અપ કરે છે, નોટ ગોઈંગ પ્રોપર. એબ્ડોમન શુડ કમ આઉટ. કેન યુ ડુ ઇટ? થાય છે? સાયલેન્ટ કરી દઉં તો આપણા બીજા 400 લોકો હેરાન કરે. તમે તો કરતા જ હશો. હાઉ કેન યુ સિંગ વેલ, સચ અ ફેન્ટાસ્ટિક સિંગર. Breathe in, breathe out. So all of us, this practice, so how many exercises we have learned so far? This guy doesn't like me. Feet curl, cervical extension, lumbar extension, auto stretch and diaphragmatic breathing. Thank you so much for this. Now, quickly, I want to show you some hope in life. Hook lagi gayi hai? Question answer session. I have 1 or 2 topics. એક ટોપિક છે વેરિકોઝ વેઇન, એક ટોપિક છે યુરિન લીકેજ, પેલ્વિક હેલ્થ. 5 મિનિટ જો સમજવું હોય તો એ પર વાત કરી શકાય, 10-15 મિનિટ. બટ સમથિંગ વિચ આઈ ડોન્ટ વોન્ટ ટુ મિસ ઇઝ ન્યુરોપ્લાસ્ટિસિટી, વિચ ઇઝ hope for all of us in today's time. What is neuroplasticity? It is brain superpower. Let's stand all of us and do this practice. Bada ubha dejiye. Pat your head with left hand and right hand and roll your tummy with left. 2 things. One is pat, another is roll. Where is my photographer friend? Go. Pat your head with right and roll your tummy at the same time. નથી થઈ રહ્યું ભાઈ, શું થઈ રહ્યું? એક જણ પેટ ધ હેડ, રોલ ધ હેડ કરી રહ્યું. ઓકે, કેન યુ પુટ નેક્સ્ટ સ્લાઇડ? યસ, લેટ્સ ડુ ધીસ. થેન્ક યુ. ડ્રો સર્કલ ઇન એર વિથ લેફ્ટ હેન્ડ. પતી ગઈ એક્ટિવિટી, શું કોઈ બીજી ચાલુ કરે? હવે આપણે સર્કલ in air with left hand and triangle with right hand. Circle in air with left hand and triangle with right. શું આવે? અઘરું છે? હા? No, bhai, Hansi, my friend, what's your name? Aslam bhai told me that brain doesn't allow. Let's pick up the words. Brain can allow anything and everything that is possible. So you are doing both round, right? Yeah. No, let's do triangle and round together. It's a matter of practice. More you are able to do that, more those pathways are getting ready and we are able to create structural neuroplasticity, which is the... हाथ मिलाओ यार. Really? So, are we able to do it? Video लिखो जी लोग. Yes. Not really? Tell me everyone quickly, could we do it or not? So let's do it. You are doing it, but you are not doing this. You are doing this, and that. Gurdeep Bhai is doing amazing. Gurdeep Bhai is yes. So my dear friends, now let's stop this. How many of us could do it or not do it? We are not getting into that, but we are clearly saying that today we could not do it. But if we practice that, we can do it well. Neuroplasticity is limitless. Look at this. Sheetal Devi, 16-year-old armless archer. She received the Arjuna Award from the President of India. She made headlines by winning 3 gold medals in Asian Para Games. Are you aware about this girl? She is suffering from the condition called as phocomelia, which is absence of arms. She was born with absence, she was born without arms. Now, one fine day she decided, I want to do this. As a family, everyone decided, let's do this. And she started doing practice with legs. Look at the next video. પાછળવાળાને દેખાય છે ને? ઊભા રહેવામાં વાંધો નથી ને? હું 2.5 કલાક ઊભો રહ્યો, તમે 1.5 કલાક તો રહેશો ને મારા ફ્રેન્ડ્સ. So brain is the boss. If she can do this, we can do anything. There's the capacity of our brain. So why did this phocomelia happen? Do you know that? There is this chemical called as I didn't. Yeah, that medicine, thiazomide, I don't remember exact name. If somebody is given it for motion sickness, mothers, are you a gynecologist or physician or genetic scientist? What's your name? Yeah, but we must clap for her. She's the one who knows that. So when you take that particular chemical during pregnancy, it is given to mother for motion sickness. And we say, and sometimes our doctor say, le lo ne thodu su bandho che. This happens. And everyone is not lucky to have Sheetal Devi. Otherwise it becomes disability. So our goal here is we are going to talk on something called as neuroplasticity. Ladies and gentlemen, you can take a seat for 5 minutes and then again we will send. What is neuroplasticity? Neuroplasticity is the ability of the brain. Not so long ago, it was believed that brain is a rigid structure, hardwired, fixed. We cannot change it after childhood. But now, last many years, research says that brain is a plastic structure, adaptable, rewirable. The pathways that you use more, you make them stronger. It's a structure of 100 billion neurons, 100 trillion connections, and the most complex and most advanced object in the known universe. It is constantly changing every second. So neuroplasticity is the ability of the brain and nervous system to learn, adapt, rewire, reorganize. And there are two types of neuroplasticity. One is structural neuroplasticity. For example, you start learning guitar or start swimming, your brain is completely adapted for that skill for the lifetime. You don't, कोई गाड़ी चलाता हो तो भी गाड़ी चलाता थोड़ी भूली जाए. हमारे फ्रेंड है ना स्विमिंग क्यारे आवड़ी नहीं. कई बार स्कूल में आवे तो इनके कोई टाइम भी करियो ना दिल. अरे टोपा. Once you learn swimming, you cannot forget swimming. It's a structural. But I am going to talk now about functional neuroplasticity, which is based on injury healing after brain injury. For example, are we all aware? Our right side of the brain controls left side of the body, and left side of the brain controls right side of the body. If this part of the brain is damaged, our goal is to feed movement to the brain. So area of brain will get activated. And if the area there is that patch which is not into hibernation zone, which is completely infarct, will not improve, there is no scope, then the neighboring cell will start taking over, and we call it as functional neuroplasticity. It's the hence brain can relearn lost movement and function post brain stroke, trauma, illness. That's called as functional neuroplasticity. Look at this image. It takes months to get the new circuit. For example, this is the new connection developing within our brain. The neurons are getting connected by doing repeated practice of specific tasks. Look at this. Can you see this? These are the real functional scans. Now they are together. Can you see this? There is connection. This is pre-synaptic. This is post-synaptic. The neurotransmitter is released, and they both start getting us into movement. Some cases. Mr. Balwant Gajjar told me on the day after the severe neuro issue that I want to do suicide. Rather than living this life, I want to die. From that point to where we brought in is a big hope for all of us in a neuroscience. He climbs 4 floors every day now. Not able to simply comb hair or drink water freely here. But 6 sports we have. We talk of spinal cord injury. This lady suffered with cervical spinal cord injury at C4-5 level, was operated, post spine surgery, she got complete paralysis, both arms and legs are lost, zero power. Now today she is cooking, she is walking, she is doing stair climbing with the most advanced neuro rehabilitation and neuro robotics that is done at Mission Ahmedabad. Look at this gentleman, Mr. Rajesh, who recovered from right-sided paralysis in 1 month. Or this lady doctor from Rajasthan, she is herself a general surgery student, and after suffering from road traffic accident and traumatic brain injury, she was said by the doctors there that she will live reasonably good life but not completely normal. Now we got her back to first year general surgery study. Medical Council has already approved her. She is authorized to participate in surgical study. With Mr. Rafiq, from complete paralysis to 100% normal life. So neuroplasticity is the maximal repetition of the movement in the correct pattern in the task-oriented environment. Little heavy words, but specifically when we repeat physiological movements and we do complete repetition. Mr. Kamlesh Kothari, I guess, what's his surname? So he suffered with massive brain stroke while he was in Kashmir. We airlifted him to Ahmedabad, 7 days in hospital, did neuro rehabilitation. Today, in 2 months' time, he is completely participating in business and everything. So we have this concept of neuro-robotics and neuro-rehabilitation with inpatient department where we do maximum intensity. For example, post-brain stroke, generally session would be given for 45 minutes, 1 hour, 1.5 hours. Our rehabilitation is intense for 6 hours, 8 hours. So somebody thought, we had this patient from Mandvi, Sunamatu Sagarami, Dilip Soni. He suffered from brain stroke, 8 hours and a physio. He came for 1 month at Mission in Ahmedabad, and his son called Dr. Sagar and told, sir, 8 years what we didn't get, we got in 1 month. We had this lady Punjabi family called as Miss Madhu Gogia and Mr. Prithviraj Gogia. Very fantastic couple. I have never seen husband like Prithviraj Gogia. We used to call him Master Chef because Madhu Ben was brought to us in a semi-coma stage. It was told by the medical team that she will survive, but in semi-coma stage, but not long. She was admitted with us for 15 months. She was admitted in room number 305. So when she was getting discharged, she told me, Alap sir, room 305 doesn't belong to Mission Health, it belongs to me. She was told she will be in semi-coma for rest of the life. Today she cooks, she dances, she makes her son study. Now 15 મહિના જ્યારે આપણા ત્યાં એડમિટેડ હતા ત્યારે સમજવાની સ્ટોરી એ છે ફર્સ્ટ 6 months she was on liquid via right nasal tube. Mr. Prithviraj Gogia only took liquids, he himself. Then she was on semi-solid for a few months. Prithviraj took only semi-solid. And then she was on ideal food and Prithviraj Bhai took ideal. So I always used to see in my round, Prithviraj Bhai is always in kitchen. We have a very good functional kitchen within our premises where patient's relative can cook for, because it's a long stay for neuro patients. So we always see him in kitchen. So we used to call him Master Chef. Now 15 months down the line, Ramesh Bhai is totally normal family. 15 મહિના દીકરો પણ ત્યાં હતો કારણ કે નાનું બાળક કોણ રાખે, યંગ કપલ હતું. એક લાસ્ટ કેસ મેં કાલે ડિસ્કસ કર્યો દીપકભાઈ, યંગ બોય રોડ ટ્રાફિક એક્સિડન્ટમાં એના 2 પગ અહીંયાથી કપાઈ ગયા, અહીંયાથી ટોટલ 2 કપાયા. આઈ સેન્ડ યુ ધ વિડીયો, રમેશભાઈ, સેન્ડ ટુ એવરીવન. ઇટ્સ અ વેરી મોટિવેટિંગ સ્ટોરી. અમે એના ફાધર વોઝ વેરી બ્રેવ. એક થેલીમાં 2 પગ લઈ લીધા અને હોસ્પિટલ અમે લોકોને કોલ આવ્યા હતા, મારા અંગત હતા. અમે વિધિન 1 hour વી મેનેજ ટુ ગેટ ગેધર 8 સર્જન્સ, plastic surgeon, vascular surgeon, neurosurgeon, orthopedic surgeon. Entire team was present. Within 1.5 hour, entire team was present in one premises. Operation lasted for 8 hours. Every small thing was stitched. Vascular surgeon, neurosurgeon, plastic surgeon, orthopedic. 6 months of rehab, he walks. He can walk from that point to this point 20 times independently without any support. So I will send you a video of this work, which we should share to everyone. So our brain is not designed to make you happy, that is your job. I think these 3 topics now, Anand Ambani style, we should not go. I have very good 2 topics, varicose vein and urine. Should we keep it for the future? So I get another chance to come to Kisumu. What do you say, Ramesh bhai? Very brief you want? Should I talk on vein or urine leakage? Choose. Here I am. Miss Sarika Majidya, 50-year young female mother of 2 children, 2 young daughters, studying in finance universities in USA. Ahmedabad's very prominent family, very respected family. I would say very humbly, this money of things doesn't matter. but this is family platform, I can share that. Must be a 10,000 crore family. She was traveling to USA by flight. Was in US for 2 months, traveling in different states by car, hanging legs. Traveled back to Ahmedabad. Second day of returning to Ahmedabad, she suffered with massive deep vein thrombosis, which is byproduct and secondary complication of varicose vein. The clot dislodged from calf to lungs, pulmonary embolism. 24 hours we tried to survive her, but we could not. This makes us create very, very sincere awareness on this subject. Because legs do not speak. Whenever patient is coming to us with leg pain, we have various thoughts in mind, be it a muscle tear, be it vitamin deficiencies, be it diabetic neuropathies. Diabetic neuropathies, for diabetic is one subject that we will talk some other time. Be it nerve compression in the lower back, which is giving symptom in the legs, be it varicose vein, a lot of subjects. But today's discussion we will limit to varicose veins only. What are varicose veins? Enlarged, twisted veins that often appear blue, dark purple or green and are commonly found on the legs. આમાંથી કેટલા લોકોના પગમાં પતલી ઝીણી બ્લુ ગ્રીન નવ વેઇન અથવા તો ફૂલેલી નસો દેખાય છે? So many of us. This is the data. 7 out of 10 women are suffering with varicose vein. This is another data. 50% cases are not having any symptom. कोई symptom नहीं. When there are no symptoms, we don't pay attention to it, right? 30% cases have pain, heaviness, swelling. 15% cases catch the infection or ulcer. 5% cases come with DVD. My dear friends, આપણો આજનો આ 10 મિનિટના ટોકનો એક જ ઓબ્જેક્ટિવ છે. આપણે આ 20% કેટેગરીમાં નથી આવવું. આર વી ક્લિયર? બેન, આપણે બધા ક્લિયર? Why we are understanding this talk? We don't want to get into this category. What we don't want, can anyone tell me? Raise the finger. શું અવોઇડ કરવું છે? આપણે કેમાં સમજી રહ્યા છીએ? We want to avoid infection. We want to avoid ulcer. We want to avoid thrombosis. We want to avoid clot. દેખાવમાં ચાલી જશે. એમાંય નથી ચાલવા દેવું, પણ એ ચાલશે, પણ આ તો નહીં ચાલે. This is human circulatory system. The blood is pumped from heart to the body via arterial system, but blood is brought back from body to heart via venous system. And there are natural physiological disadvantages with venous system. For example, blood coming from bottom to top is little heavy in weight. Why? Little heavy in weight. Why blood is heavy in weight? Because of this, you will join me next workshop in Kisumu, we will do it together. So, because there is accumulation of metabolic waste products, specific gravity is high, blood is little heavy. Second is this movement is anti-gravity, bottom to top. Third is there is no pump in the vein versus that in the heart. Heart to pump chene, vein don't have pump. And then series of other physiological things happening to our female family member sitting right here. Pregnancy, when during pregnancy uterus grows, it puts pressure on the veins, valves. You stand a lot, 3 hours in the morning, 3 hours in the evening. Again second pregnancy, again you stand a lot. Series of changes happen throughout the life, and as a result of obesity, prolonged staying age, pregnancy or genetics, we suffer from varicose veins. This is a normal function of valve. Normally valves open, blood go up, valves close and things are maintained well. But when valves open but don't close properly, blood bounce back. So the veins wall get dilated, valves get incompetent, and this happens. Can you tell me where is our second heart? बीजे क्या हुआ second heart? I was taking a workshop for Podar International School teachers last Saturday before I came here. This Sunday, I'm talking of last Saturday afternoon. One of the enthusiastic teachers told me when I asked where is the second heart, she said it's with my husband. And I'm very happy to know this. Our second heart is in the calf. When we contract calf, veins are pressed and they send the blood upward. So we'll learn the exercise as soon as the talk is over. So this is the sequence of varicose vein, and then we start developing either spider vein or varicose veins or swollen legs or leg cramps or this eczema or lipodem. Out of 10,000 varicose vein patients we have treated without surgery, at least 10%, that is more than 1,000, have presented with such color post-surgery. Surgery is not the ideal solution in this condition, we should always be avoiding. But some of us come up with this thing called as deep vein thrombosis. Then we may have to take blood thinner, and we need to do this color Doppler report every few years to know whether DVT is there or not. Or if some of us sitting in this room are already having severe varicose vein, we should do preventive color Doppler of the veins. And we should always look for the line which mentions no DVT. No DVT is a safety. Or ulcer. In India only, more than 80,000 legs are affected due to varicose vein and diabetes combination. Who are affected? Teachers, sedentary lifestyle, housewife, driver, policeman, hairdresser who spend a lot. So non-surgical treatment is laser, with help of which we focus on that specific veins, which improves microcirculation, oxygen nutrition flow to that area increases, and the blood flow to the area starts in a much better way. And with the pressure garment, this is laser, which has its own effect. I will not go into much detail now, but non-surgical varicose vein treatment is the safest method. And then we drain it. See, risk of stasis. Blood properties which the blood has to be in movement. The minute blood is not in movement and it is steady, clot na chance. So we have to always keep it moving. And that's why, and a simple thing, whatever we learn today is for prevention, but somebody already having varicose veins, we have to push the metabolic products back. Otherwise, it can create infection, ulcer, or a lot of other complications. This is where we drain the. We have to push the. So number one, laser. Number two, circulation, pushing mechanisms. And number three, some of us, this is our first patient who was suffering with diabetes and varicose ulcer, was advised amputation because the infection was spreading. And with one of the wound healing technology that we specialize in, within 30 days we got this. And today 10 years, this lady is safe. And many ulcers we did, but we don't want to get this. Avoid whatever foods that is not allowed, weight control, elevate your legs. At the end of the day, all females sitting out here, or let's say every one of us, must elevate our legs at least 15 minutes. Kariye chhe amati koi? Let's start doing it from today. Second important thing is sitting to standing karya kariye, tight clothes, abdomen level par nahi darwana. Let's all of us stand and practice this calf exercise. So there is a very scientific varicose vein drainage protocol, which is a protocol in itself which I cannot teach because 15 minutes of program છે આપકો જે રોજ કચરો ક્લિયર કરવાની એક પ્રેક્ટિસ શીખવાડે છે. But this is something which we can implement right today. Heels up, toes up, heels up, toes up, heels up, toes up, heels up, toes up, heels up, toes up. We must start doing this 10 times morning, 10 times evening, and whenever you get chance in kitchen, or even if you are sitting in office, or even if you are having horizontal placement of the legs. Are we clear with this? We'll stand for a while. Legs just don't walk, they conquer mountains. And this brings me to something which I'll quickly show you because it's tempting to complete this talk. Look at this video. We want to sit, we can sit. Let's have a seat. This last 5 minutes.
Very big. It's so big that I actually have a Christopher walking for us. Hold it up and it's like, these shoes, nice. Look good. Wait, yes. What is your problem? You haven't laughed once. All night. You look like you were in pain. Did you have the nachos? I warned you about having the nachos. I bet you're an ugly laugher. That's what, hubby, she looks like it's her head when she does. You know what? Let's figure it out. Because tonight, lady, I am going to be your worst nightmare. You look like this all the time. This is what the practice look like. You look like you're like 2 meters of a walk. There she goes.
Bladder leakage is not a laughing matter. Imagine you are sitting in the middle of important meeting. Imagine you are standing on a stage in a social gathering, or imagine you are sitting with friends, laughing out loud, and your body starts betraying you. You start feeling panic. You start feeling warm. And you completely feel lack of control. I am talking of something called as urine leakage, which is one of the big problems. People are suffering with this issue in silence, big time. This is not a degenerative. Only 92 million people are suffering with this problem. In our own data, we could see out of 500 households, 68% female were suffering. If you understand, 40 to 50 years, 30% were suffering, but age વધતી ગઈ એમ એનું population વધતું ગયું. But the shocking fact was 58% of female suffering from urine leakage had never discussed this issue even with a spouse or a family. Last week in my consulting, I was sitting with close friend of mine from Saudi Arabia, Adnan Sayyed. His wife discussed about urine leakage with him first time in front of us, and he came to know that she is suffering from 5 years. One of the lady I consulted last Monday, 110 kg weight, 5 normal deliveries, 2 miscarriages. As soon as she stand, leakage will happen. This is one of the very, very sensitive and burning issue. Pelvic floor is the muscles between the thigh stretched from front to back with two important functions. Number one, to support bladder, uterus and bowel, and number two, control the continence of the urine and stool. But ideally it is like hammock. It should be horizontal or little convex, but when it is more concave convex, it is a sign of weakness of the pelvic floor muscles. And when the weakness of pelvic floor muscle is there are multiple issues. We will discuss on only urine leakage quickly. Urination is a voluntary process. When our brain finds ideal place, we do the process. But when our brain is absolutely in control, but muscles are not in control, brain cannot do anything, because here it is all about muscle. One of the leakage is called as stress incontinence. When the pressure in the abdomen rises by coughing, sneezing, laughing, lifting weight, the pressure is transferred to the pelvic and the urine leakage happens. Another variety is arterial, where there is little volume in the bladder. Before you reach to the bathroom, this leakage happens. This is really shattering life of many, and this is one of the commonest reasons is pregnancy. My salute to all the mothers sitting here, the kind of process that happens during all these months, and there is big salute to all the female, because that process is something, uterus grows, pelvic floor muscles are loaded. Normal delivery is a real fight between 4 kg baby coming out versus pelvic floor. Let's assume the normal index of pelvic floor muscle is 100, it's Sono index. Post delivery it comes to 70, but it never goes above 80 after first delivery. If somebody is said doing second pregnancy and delivery, the index comes to 50. After healing it goes to 60, but there is always lack of 30 to 40% strength after 2 deliveries. This is always a missed upon difficult childbirth, aging, diabetes, UTI, obesity, prostate, hysterectomy. Imagine hysterectomy, 3 organs supported chair, and uterus is taken out. So now literal swing, seesaw will start happening. One of the most fluctuating mechanism in the muscles setting. So if untreated, it leads to infection, vaginal, kidney, depression, social. 65-year couple thought that we have a retirement by super ફરવા જવું છે. શું થશે? બેનનું લીકેજ એટલું વધારે છે, બેન ડાયપર પહેરવા રેડી નથી. કોન્ફિડન્સ છે, એક આંટી આવી મને કે ડૉક્ટર દિવસમાં 4 વાર પાયજામો બગડે છે. એક યંગ લેડીનું કે 12 વાર ડાયપર બદલવા પડે છે. This is something which is, એક બેન એવું કીધું કે લોક ખોલવામાં વાર લાગે તો લીક થઈ જાય. So this is something which is not discussed, but it has lot of પાણી પીવાનું ઓછું કરવું પડે. રાતના 4 વાર ઉઠીએ તો ઊંઘ બગડે, એના બીજા પ્રદર્શન હોય. અને દવા આની કોઈ આઈડિયા છે જ નહીં, ક્યાં સુધી લેવાની? એના પણ ડ્રાય માઉથ, ડ્રાય આઈઝ, બ્લરિંગ ઓફ વિઝન, જેને અત્યારે લીકેજનો પ્રોબ્લેમ છે એને ઇવેક્યુએશનમાં પ્રોબ્લેમ થાય, એવી સેકન્ડરી કોમ્પ્લિકેશન, બીપી ફ્લક્ચ્યુએશન, હાર્ટ રેટ ફ્લક્ચ્યુએશન. અને સર્જરી ઇઝ નોટ અ ઓપ્શન. Urethral sling surgery, many patients have reported. Originally they had a leakage problem, now they have passing problem. They have to push, but they are not able to evacuate. And 5% population have resulted into permanent retention of urine after surgery. So they have to be catheterized. So we are not looking at something like this. We want to do exercise. In our yoga, before so many years, there was something discussed as Mulbandha. Mulbandha, right? What is the name? But in 1940, Dr. Arnold Kegel coined the term called as Kegel's exercise, which many people sitting here knows. આમાંથી કેટલા લોકો રોજ વોકિંગ કરે છે? વોકિંગ કેટલા બધા? આમાંથી કેટલા લોકો 3-6 મહિને ફેશિયલ કરાવે છે? આંગળી ઊંચી કરો ને, કંઈ વાંધો નહીં, મિત્ર રાજ ही रहने देना है. So moral is what? આમાંથી કેટલા લોકો pelvic floor exercise કરે છે? So hardly 1-3% population. If you look at the data of the world, 1940 માં આ concept throw થયો. યોગાએ તો વર્ષો પહેલા આપ્યું. 84 years after throwing this control, even 1% population of the world is not doing this. So we want to do this pelvic floor exercise, right? બહુ ડિટેલમાં એને શીખીશું ક્યારેક. ટાઈમ બહુ જ વધારે મેં લીધો છે, પણ વી આર પેશનેટ. વી વુડ વોન્ટ ટુ સ્પ્રેડ એઝ મચ એઝ પોસિબલ. અને વી આર ઓન વર્લ્ડ ટૂર. ફરી કિશુમાનો ક્યારે નંબર આવશે ખબર નથી. Kisum is so beautiful. I would like to bring my family here. I like this town. એટલે એ એક રીઝન છે કે એના માટે કદાચ આવવાનું અથવા તો લેટ્સ સી તમે જો ફ્યુચરમાં કંઈ કરીએ તો. સો મિસ્ટેક્સ પીપલ ડુ while doing Kegels exercise, all wrong commands. Ideal command is sit quietly, take a deep breath, all of us. Breathe out. When you breathe out, try to squeeze your pelvic floor, the muscles between the thigh, and lift it. Squeeze and lift is the most ideal command. ઘણા લોકો એવા કમાન્ડ આપે કે મિડલ ઓફ ધ સ્ટ્રીમમાં યુરિન રોકી દો, that is not the ideal. એ સમજવા માટે બરાબર છે. So squeeze and lift, it can be done in various positions, sitting, standing, squat, walk, functional position. It will help. And once you learn it, it is fantastic thing for each of us sitting in this room. કરવાની ને બાયસેપ્સ કરીએ તો આ કેમ નહીં? આ વધારાનું થોડું છે. It is lot of life functions are attached. So, and somebody who cannot learn એને ખાલી lift કરી શકે, quick hold, quick lift. We'll learn that when this is the revolutionary technology we have brought in India called as Kegel. In this technology we give 12,000 contraction in one session. And finally શું થાય? You look at the pelvic floor. See, the convex, weak, completely, this pelvic floor cannot control versus the horizontal, which is nicely able to hold and control everything. So this is non-invasive. People of all ages stay fully clothed during treatment, completely hygienic. 12,000 Kegel contraction for age group 30 to 46 session, 40 to 59 session, 50 to 60 12 session. 70-80 people might take little more sessions, but this gives fantastic results.
For centuries, historians have been confounded by the infamous Mother Teresa's smile. What was behind that mysterious expression?
Perché non sorridi?
Perché voglio essere qui. Odio questa sedia. Mi siedo qui tutto il giorno. Devo fare pipì.
Pipì? The prolific inventor, it seems, had quite the innovative solution for Sal and Lisa.
This 12,000 contraction, who can benefit from pelvic floor? Everyone who is planning for pregnancy, post-delivery immediately. Post-delivery પહેલા pelvic floor કરવું પડે કેમ? Because pelvic muscles are weak and you start, બધાને કેવું પેલા પેટ અંદર લઈ લઈએ. પેટ થોડું બહાર આવી છે delivery પહેલા. So we do a lot of abdominal exercise. But before doing pelvic floor, when we do abdominal exercise, we are putting strain on pelvic floor. Or we lift weight. We lift 10 kg weight again. So first and foremost, third day onwards, we can start doing pelvic floor exercise post-delivery. And even during pregnancy, throughout the pregnancy, we should do pelvic floor exercise or post-menopause for diabetic person or prostate surgery or hysterectomy or lot.
Hi, I am Navin. I am 18 years old. Last April 2020, I was diagnosed with quadriparesis. There was infection in my spine and all 4 of my limbs were paralyzed. My back and abdominal muscles were also compromised. I had lost complete control and sensation of my urine and bladder and bowel movements. I came to Mission Health from Pune in last July and took treatment over here for 6 months. After roughly 15 to 16 months, I can walk properly without any assistance. I can perform every day-to-day activities without any problem. I can even ride a bike. But still, I am facing deep problems with urine incontinence and urinary leakage. Whenever I do any stressful or tedious activities like gym activities, cardio movements, or any hasteful movements, I feel the urgency to go and to find a washroom. If I'm not able to find one soon, then I leak my diaper. And because of that, I have to wear my diaper everywhere I go. Urinary leakage is a deep problem which I'm facing every day. But after I heard about a urine incontinence machine over here in Michelin, I took 2 sessions of the urine incontinence machine, and there is significant improvement.
मेरा नाम श्वेता नित्य है। मैं कुक्षी
24 hours she had to wear diaper.
8 साल से यूरिन प्रॉब्लम को लेकर परेशान थी। इस प्रकार से जैसे खांसी होना, छींक होना, ड्राइविंग करना, तो 24 घंटे मुझे पैड करना पड़ता था। डॉक्टरों को दिखाने के बाद भी कोई मुझे रिजल्ट नहीं मिला। मेरी उम्र टूट चुकी थी, पर मुझे अहमदाबाद के मिशन हेल्थ साइंस सिटी फिजियोथेरेपी के बारे में पता चला, तो मैं यहाँ पर रीचा मैम से मिली और उन्होंने मुझे इलेक्ट्रॉनिक रिजल्ट के बारे में बताया। तो मैंने जब उसका ट्रीटमेंट लिया तो मुझे 1 महीने में ही उसका इम्प्रूवमेंट मिला है, और अब ना तो मुझे पैड
Lose weight, do not restrict water intake, maintain a scheduled diary, avoid carbonated drinks, smoking, check blood sugar, and if required, stand up for urinary incontinence. Asana, thank you so much for patience hearing, and whatever best possible subjects in whatever given time we had to cover these. All subjects are in itself a separate program, but try to touch as many things as I could. Thank you so much, Asante Sana. We open the house for question and answer. We will ask 4 to 5 questions. Mic can be given in the audience. My request to all the participants, whatever question you ask must be relevant to everyone, not individual problem, so everyone can get benefited from the same. Please, any question? Suresh. Mic आपको नहीं Please, सुरेश भाई ने mic की जरूरत है। તમે બોલાવો Thank you. Question which is applicable and relevant to everyone. Please, can you speak a little louder? से जाकर आगे जाओ। हाँ, बहुत important है। आई हूँ पण कहूँ છું। So this is very important subject. Can I ask your age? 62. So there is something very fantastic that we keep discussing. We call this understanding as bone banking. Remember the word. What word? Bone banking. Anyone of you have heard the word osteoporosis? Osteoporosis is the terminology which is used to describe the weakness, the reduction in the bone mineral density. Understand this very well. There are 2 processes happening in our bones, osteoblastosis and osteoclastosis. Osteoblastosis increases bone density, osteoclastosis decreases bone density. Now, for our understanding, we all should be clear, 17, 18, 20, 22 વર્ષ સુધી જ osteoblastosis થાય. For example, after 18, 20, 22 years, osteoblastosis, that is bone mineral increasing activity, do not happen. And then there is a neutral phase, and then post 45, when menopause comes, estrogen deficiency, estrogen is not there. So entire osteoclastic activity goes on a peak, and we start getting into cycle of osteoporosis. Now how do you fight? One is D3. D3 is important for calcium. But what is important for D3? K27. Never take only D3. Take D3 with K27. This is a fantastic combination which facilitates absorption of D3. Once D3 is good, you also take calcium. Always keep your blood calcium level normal, because if blood calcium is not normal, blood is very smart. It will pull the calcium from the bone. So we have to maintain optimum blood and bone calcium. Now when your D3 calcium, everything is good, you need to do exercise which is moderate impact, high impact, depending upon your age group, your joints, and you have to participate in bone building resistance training. Remember my word, resistance training is a science by which we can keep our bones stronger. We are taking our blood calcium level high and then we are doing exercises which will drain blood calcium to the bone. આપણે ગુજરાતીમાં કહે છે ને માંગ્યા વગર તો માએ ના આપે. એટલે બ્લડ કેલ્શિયમ હાઈ કર્યા પછી બોનમાં ડિમાન્ડ કરીને એને પુશ કરીએ છીએ આપણે. ઇટ્સ અ ફેન્ટાસ્ટિક કન્સેપ્ટ. આપણે એના પર ક્યારેક વિલ ડુ વન થિંગ રમેશભાઈ, એકવાર છે ને 1 અવર ઓનલાઈન ઝૂમ ઉપર બધાને ઇન્વાઇટ કરીને વિલ ટોક ઓન ધીસ સબ્જેક્ટ. આઈ થિંક ઇટ્સ અ રાઇટ વે ટુ ડુ. વેર ગીવ યુ આઈડિયલ ગાઈડલાઇન and once we will also connect online for this concept called as future of medicine with Dr. Disha, my boss. She is a neuroscientist plus functional future of medicine specialist, where we work at the root cause of issue. For example, somebody has uric acid, then rather than giving allopurinol or goutnil or touching reducing protein, we identify where is the issue. Somebody has rheumatoid arthritis or autoimmune arthritis, rather than giving methotrexate or hydrochloroquine or sulfasalazine, we focus on why autoimmune system is dysfunctional here. So we do online now next time. Physically તો આવશો જ અહીંયા યોટ ક્લબમાં તમારી જોડે પાર્ટી કરવા. Next question, please. Yes, brother.
Hello. Thank you very much. I just wanted to find out from you whether I recently did something for my wife was having a knee problem. I took her to Nairobi, the country there. What she's doing is removing blood from one side of the right knee, and actually the left was paining, and then she's injecting with heat.
This call is PRP. How did she feel?
She felt better, but again the pain came back different.
So PRP worldwide research are now discouraging. Where we take the blood from our own body, we rotate in a platform, prepare specific material which we push inside. But some people have benefited, many have not. So results are not so promising. Every year we read research, we have one team. I would take this humble opportunity to invite all of you to visit Mission Health Ahmedabad as our guest. તમને આ નંબર જે આપ્યો છે ને, whenever you are in Ahmedabad, just give us reference of Hindu Council Kenya, Kisumu branch, all the 10 friends, name each, Mandavia Sahib, Ramesh Bhai, Suresh Bhai, So, and we will try to show you something which is science last possible innovation. And how we can make things better even without any procedure or medicine or injection. So we have one research team which constantly keeps analyzing this. So PRP results are not long lasting. We must identify the root cause and focus. We discussed 13 causes, and we have to focus on that. That will be more. I personally have not seen good results with PRP in clinical setups where patient gives me feedback, but my personal doesn't work. We work on numbers. So world data says that it is not encouraging. Any other question? Please, sir.
Thank you for your very, very informative talk.
Thank you, sir.
We find most of the elderly people with stooping gait. I want to know what ratio should be there between the flexion and extension in daily life. Because most of our activities are activities involving the flexion. So what is the ratio? Should it be equal flexion and extension? And if it should be equal, what should the elderly person be doing every day, continuously, in daily walks of life for the extension?
So this is a fantastic question. I mean, what we discussed in workshop. Sir, which faculty of medicine you belong to?
Sorry?
Which faculty of medical science?
I'm a general practitioner.
Fantastic.
I'm from GS Medical College, 1969.
GS Science?
No, it is in It is KEM.
One of the most reputed medical colleges. You have been here since how many years?
Over 55.
Okay, so fantastic. So now sir's question is very much relevant. As we all understood, we do flexion throughout the life and throughout the day. And we don't do extension. Technically, many of us sitting in this room who is cautious, who is aware, is definitely doing extension. But rest of us are not doing it. So there is a scientist called as Robin McKenzie. He has done a lot of work in this field. We are also inspired by, we also take inspiration from world and whatever we are observing. He has given the concept of balancing, and we named the workshop as balance. So For example, if you are a computer professional or you are working on mobile and you are doing flexion of neck for many hours, I would recommend 10, multiple cervical extension every hour. Now if you sit long, we will be balancing the sitting by standing every 30 minutes. I think all of us will put this into practice. Stand every 30 minutes. We are clear on this? બધા કરીશું કે ખાલી વાતો? આપણે પેલું કહીએ છીએ ને, શેઠની શિખામણ, એવું નહીં થવા દઈએ ને? અથવા તો સ્મશાન લઈ રાખીએ, સ્મશાનમાંથી બહાર આવીએ ત્યારે એમ થાય કે આ જીવનમાં તો શું લેવા દેવાનું, બીજી મિનિટે જ આપણે બોર્ડ મિટિંગમાં બેઠા હોઈએ એને ખ્યાલ આવે કે ઘણું બધું કરવાનું. સો લંબર એક્સટેન્શન, જે લોકો બહુ જ બેસતા હોય એને લંબર એક્સટેન્શન એવરી અવર, but if not, it is morning, afternoon, evening. Sleeping straight, which is also anti-flexion. And doing this anti-gravity, if you could relax, sir, it is an extension exercise. Then there are series of posture correction exercise which we can teach you online, because today 10-20 minutes of exercise teaching is not the guidance. We can do frequent things once a month and we will do it honorarily whenever we want, because we understand one thing. There are two most important points of life. One is when you are born and one is when you know why you are born. We have a complete clear mission of what we want to do. When you will see our setup working, we change 1,000 lives every day. We have patients coming from more than 300 cities of India and world. When you see this at the end of the day, happiness in among the families, it's now equal passion. So we would, the point coming is whenever we want, we'll keep doing some activities here. There are much better 10 to 20 exercises which we can teach you, which has to be done in the morning to keep our anti-gravity muscles strong. It is not only about muscles, it is bones also. Jaya Bhaduri and Amitabh Bachchan, if we see, પહેલા છે ને જયા બહાદુરી અહીંયા આવતા હતા. હવે તમે જોશો ને હમણાં આનંદની લગ્નમાં તો અહીંયા આવે છે. યુ ગેટિંગ માય પોઈન્ટ? જયાબેન અહીંયા હતા, હવે જયાબેન અહીંયા છે તો એમને શું થઈ ગયું અચાનક? Osteoporosis. Every year, post 40, there is reduction of height if you don't take care of your bones. 1/3 of each, that is 1 centimeter. So, we learn on bone, we learn on muscle, we learn on anti-gravity muscle, we learn on extension exercise, and we want all of you participating in the, આપણે છે ને પ્લેજ લેવડાવશું, એ ઝૂમ ગૂગલ મીટમાં આપણે જેટલા લોકોને ઇન્વાઇટ કરીએ ને એકદમ ડેમોન્સ્ટ્રેશન કરશે મારી ટીમમાંથી, એ લોકો કરવાના હોય ને પ્લેજ એને જ આપણે એમાં આવવા દેવા. So we make it more successful. But good question, and I hope I could answer what you wanted to ask. Thank you.
Please, another mic, the one we giving someone. Can I have it?
I think last question, my colleague Gaurav Bhai said that we have to stop.
Very mic.
हाँ, सतीश भाई नु रमेश अंकल कैसे के उनको? सतीश भाई नु you will read? પછી બોલો question, speak, one person. પછી दोस्त. Last. No, there are many, but we'll do it last.
About sciatica.
Who is there? Yes, please. What do you want to know? What is sciatica? So, we talk of brain, we talk of spinal cord, then we talk of nerve, which is coming from lower back to the leg, in the front or in the back. The nerve which is coming from bottom to top, or top to bottom, it is called a sciatica, which is longest nerve of human body. Now, what is sciatica? Sciatica is a symptom, not a disease, and there are many causes for sciatica. For example, when disc bulge happens and it touches the nerve, the outer layer of the nerve is getting ischemic, lack of blood supply, irritation, inflammation, sojo આવે, અને એના લીધે પગમાં જે symptom આવે, it is called as sciatica. So we have this fantastic concept, we call it as slip disc reversal. Have you heard of L4, L5, L5S1 slip disc? આવું સાંભળ્યું છે ને? When disc is compressing the nerve, you get symptom in the leg, that is called as sciatica. Now this can be my very bold statement on the basis of experience that we do, on the basis of 60,000 spine surgeries that we have saved. 95 to 98% of spine surgeries can be saved without surgery, just by following ideal posture or good physiotherapy in your vicinity or advanced physiotherapy at a place like us, or taking proper care, we can save it. Now there is a fantastic, this reminds me of a concept called as slip disk reversal program, where with the help of software and mechanical device, we focus exactly on L5S1, we distract the segment and reverse the disk bulge. And that is a fantastic way to reverse sciatica. Then I think we will not, badaano time dinner, I think not.
If someone had S1, if someone is diagnosed with S1 and trapped nerve, can he be okay?
You are talking of S1 or you are talking of sacralization? S1 is a normal vertebral body.
Yeah, but he has got a trapped nerve.
So we have to release the trapping of the nerve. We have to identify the reason, whether it is ligamentum flavum hypertrophy or facet joint hypertrophy, whether it is bone placement, displacement which is touching the nerve, or whether it is disc bulge. Out of the reason that once we identify, we reverse the cause. This can be reversed. 95% patients can be saved without surgery. That is very clear. Thank you so much. We take one picture, all of us together. Let's stand, all of us come closer. Bhai, photograph bhai, kya hai? I don't know, mobile par. Ke gaya hai, jamba. ના હજી તાલી તો પછી પાડશું. થેન્ક યુ ભાઈ, પણ નજીક આવી જાઓ તો ફોટો લઈ લઈએ. નથી ફોટો લેવાનો ભાઈ, તો કેમ જવાનું? હા, ફોટો પાડી લઈએ પછી ફોટો ખેંચાય.
Thank you very much. Give me a few minutes, please. Just few minutes. Fantastic presentation for more than continuous 3.5 hours.
You gave me mic on 5:35.
Wonderful, doctor. Wonderful.
Upar. All of us, can we do something like this? Thumbs up, something good. Thank you. Thank you so much, all of you. Thank you.
Please, ladies and gentlemen, please give me 2 minutes. Don't go away, please. Please be seated. This is the pleasant duty which I have to do it. Please don't go away. Now I call upon, don't start dinner, please, don't start dinner. Now I call upon Sheila Chauhan to propose a vote of thanks.
Chairman, Hindu Council of Kenya, Kisumu branch, ladies and gentlemen, even good things come to an end, and so has today's wonderful event. It's indeed my pleasure to move a vote of thanks. First and foremost, thanks a million to Dr. Alap Shah for his great presentation, and I have reasons to believe all present here have enjoyed maximum, and each one of us will go home with added knowledge from this workshop. Doctor, once again, thank you so much, and we also appreciate and thanks the member of your team, namely Dr. Shagar, Mr. Gaurav Mehta and Deepak Shah. We also thank Sri Sanatan Hindu Union Chairperson and committee allowed us to use the hall and other facility. We also like to thank all subcommittee members for this activity, especially Mrs. Sujata Denudra, for preparing delicious food. We also like to thank the priest of Sri Sanatan Hindu Union Kisumu, Sri Darshit Bhai Dave, reciting the prayer at the beginning of the function. Our thanks are also due to Mr. Indravadan Patel, Jubilee Jumbo, his kind donation of 25,000, another Prakash Bhai Soni 25,000, Madhavji Bhai Karya 25,000. Give him a big clap. Finally, I thank everyone present here who made today's function successful. Enjoy the evening with the company of Dr. Alap Shah, his team. May God bless all. Thank you.
Thank you, Sita. Personally, I say, Dr. Alap, you have done a wonderful job, and I pray God to give you more and more strength to give the service to the people.
Ladies and gentlemen, I've just taken over from Dr. Alap, and you'll have to bear with me for 3 hours only, right? There is one testimonial, and I would like to read that particular testimonial. That's from a businessman from Kampala, Mr. Satish Kumar Mande, and he says, I was born with a scoliosis spine and grew up normally until the age of 55 when I began to experience severe complications in my spine. The pain was so severe that I could limp and could not even walk, stand or sleep normally. I then consulted with numerous top orthopedic doctors and other viewing my x-rays and MRIs. They were all shocked to know how I was living. I was suggested to undergo surgery with no guarantee, due to which I lost all my hope. Then appeared Dr. Alap Shah, my Sahib, as I call him, who came into my life to give me back all my lost hope and strength. Our story, my Sahib and I, goes way back to 10 years ago when I called him to describe my spinal health, and he asked me to fly down to Ahmedabad as soon as possible. Upon reaching Mission Health, I met Mr. Sahib, and he thoroughly checked me and my reports and said to me that now it is his and his team's mission to send me back to Kampala pain-free. Right? I repeat, pain-free. Mission Health's high-tech equipments and the efforts put in by Sahib and his dedicated team gave me great relief from the severe spinal complications and pain. Within 2 weeks of all the treatments and therapies, I was able to stand, walk and sleep pain-free. Within 2 weeks of all the treatments and therapies, I was able to stand, walk and sleep pain-free. I've just repeated that phrase. Thereafter, I make it a point to regularly visit Mission Health and take up therapies to keep my spinal health at bay. Words are not enough to appreciate and acknowledge all the hard work and the efforts put in by my Sahib and his team to make my life normal again and pain-free. Wow. Ladies and gentlemen, cannot be anything better than this. This is terrific. Right, while the mic is still in my hand, ladies and gentlemen, I'm sure you will all agree with me that the presentation given by Dr. Alap was absolutely mind-boggling. Fantastic. I would say terrific. Right? Very, very educative, very interesting, and 1,000 salutes to you, Doc, from all of us here. 1,000 salutes. Terrific. And I would request that we would like to see here in Kisumu more often. Right? Maybe before you go, you give us a promise that in the next 6 months, you'll be again here. We will host you, but your presentation is mind-boggling. We have learned lots and lots of things. And I'm sure, you know,
Just moment.
This is small. This is the love of Mother is always telling it's small. Keep it up. Okay.
after this Nairobi and this work.
Next, I call upon the subcommittee. Next,